Go dry your eyes and live your life like there is no tomorrow, son. And tell the others to go singing like a hummingbird, the greatest anthem ever heard. We are the heroes of our time, but we're dancing with the demons in our minds. We are the heroes of our time, heroes. Oh, but we're dancing with the demons in our minds, heroes. Oh, we are the heroes of our time, heroes. But we're dancing with the demons in our minds, heroes. The crickets sing a song for you. Don't say a word, don't make a sound. It's life's creation. I'll make worms turn into butterflies. Wake up and turn this world around in appreciation. He said, I've never left your side. When you were lost, I followed right behind. Was your foundation. Now go singing like a hummingbird, greatest anthem ever heard. Now sing together. We are the heroes of our time, heroes. But we're dancing with the demons in our minds, heroes. We are the heroes. We keep dancing with the demons. You could be a hero. Now go sing it like a hummingbird, the greatest anthem ever heard. Now sing together. We are the heroes of our time, heroes. But we're dancing with the demons in our minds, heroes. We are the heroes of our time, heroes. Dancing with the demons in our minds, heroes. We are the heroes.
You say you'll be down in 5. The smell of your perfume is floating down the stairs. You're fixing up your hair like you do. I know that I'll be a mess the second that I see you. You won't be surprised, it happens every time, it's nothing new. It's always on a night like tonight. I thank God you can read my mind. 'Cause when you look at me with those eyes, I'm speechless. Staring at you standing there in that dress. What it's doing to me ain't a secret. 'Cause watching you is all that I can do. And I'm speechless. You already know that you're my weakness. After all this time I'm just as nervous. Every time you walk into the room, I'm speechless. It started when you said hello. Just did something to me. And I've been in a daze ever since the day that we met. You took the breath out of my lungs, can't even fight it. And all of the words out of my mouth without even trying. And I'm speechless. Staring at you standing there in that dress. What it's doing to me ain't a secret. 'Cause watching you is all that I can do. And I'm speechless. You already know that you're my weakness. After all this time I'm just as nervous. Every time you walk into the room, I'm a secret, 'cause watching you is all that I can do. I'm speechless. You already know that you're my weakness. After all this time, I'm just as nervous every time you walk into the room. I'm speechless. Oh, you know that.
Je te connais par cœur, comme si je t'avais toujours connu. T'es ma meilleure amie, mon âme sœur. Avec toi, je suis dans le bonus. Entre nous, c'est physique. Comme la street, tu m'attires comme un aimant. T'es la plus belle de toutes mes musiques. T'es la brique, t'es le ciment. Viens, on se on va faire ailleurs. On va faire une autre life. Oublie nos malheurs. Viens, on se on va faire ailleurs. On va vivre une autre life. Oublie nos malheurs. Viens, on se viens, on fait d'ici. Trop de jalousie, les jeux visibles à Vélizy. Trop de fantaisie. Leur amour est faux comme un fantasy. Viens, on se bat. Une fois à l'an de tout ça, on se calme. Ne nous retournons pas. Viens, on se on va voir ailleurs. On va trouver notre life. Faut oublier nos malheurs. Viens, on se on va voir ailleurs. On va vivre notre life. Faut oublier nos malheurs. Viens, on se on va voir ailleurs. On va vivre notre life. Oublier nos malheurs. Viens, on se
Llega al club con el combo, rápido la vi lejos. Se pintaba los labios y la copa como espejo. Se acercó poco a poco y yo queriendo que me baile. Luego me dijo, vamos que te enseño buenos aires. Y nos fuimos en una, empezamos a la 1. Y con la nota rápido nos dieron las 3. Perreamos toda la noche y nos dormimos a las 10. Ando rezando la Dios para repetirlo otra vez. Y nos fuimos en una, empezamos a la 1. Y con la nota rápido nos dieron las 3. Perreamos toda Canarias, sin el equipaje, sin viaje de vuelta. Por la isla te va a dar una vuelta. Bebé, solo avisa. El sábado teteo, el domingo misa. Estoy a ver si me garantiza que te me pegas como quien graba con B-Side. Salir a las amigas del party y ella se quedó mirándonos a los ojos, no al reloj. Y nos fuimos en Uber al apartamento en privado. Me pedía que le diera un concierto. Le dije que por menos de un beso no canto. Y nos fuimos en una, empezamos a la 1. Y con la nota rápido nos dieron las 3. Perreamos toda la noche y nos dormimos a las 10. Ando rezándola yo para repetirlo otra vez. Quédate, que la noche sin ti duele. Tengo en la mente la pose y todos los gemidos.
Takes you higher, I will forever be intertwined with you. When the sun never goes down and time has slowed down, would it be too crazy if we decided to stay forever? Decided to stay forever, forever. to the fire. I'd like to see your wild side. We should run away where the sun never goes down and time has slowed down. Would it be too crazy if we decided to stay forever? Decided to stay forever, forever. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay forever.
Good morning. Welcome to the Gran Cancun Forum. We are going to start with the presentation. The keynote lecture is Inflammatory Responses in Tissue and Mucus of Reproductive Tract in Perparturient Cow, presented by Dr. Takeshi Osawa. Dr. Osawa has worked as a teaching assistant at the National University of Asunción, Paraguay. He also worked as an associate professor at the Laboratory Pteriogenology, Iwate University, Morioka, Japan. And he was a visiting professor at the Ontario Veterinary College of the University of Guelph, Ontario, Canada. He earned MSc and PhD degrees at Rakuno Gauken University, Hokkaido, Japan, and MPhil degree at the University of Edinburgh, Scotland, UK. He currently works as a full professor at Miyazaki University, Japan. His research focuses on the development of diagnostic treatment protocol for reproductive disorders, including uterine diseases and reproductive management with a fixed-time artificial insemination program using ultrasonography to improve the reproductive performance of postpartum dairy and beef cows. He is currently president of the Society of Reproduction and Development and a member of the Council of the World Association of Buiatrics. Please, Dr. Oxaba.
Hello, good morning, ladies and gentlemen. First of all, I'd like to extend my gratitude to the local association of Buiatrics, the Mexico and organization scientific committee in 32nd WBC in Mexico. For giving me the opportunity to talk in this keynote session. Okay, let me talk about, first of all, the background of cattle industry, particularly in my country, Japan. There are challenges in the cattle bovine industry. So first, there are the herd size become larger, and the labor, there is a shortage. There's a shortage of labor, so that there's a problem of stillbirth because the herd management is not, has been done recently very good, particularly in calving management, so that stillbirth can be reached more than 6%. Particularly after 300 days of pregnancy, because average pregnancy, days of pregnancy in Japanese black cattle is a little bit more than that in Holstein, which is about 290 days, not 280 days. So the economic loss can be reached to more than $100 million per year. So the part of the problem is because of insufficient monitoring in cattle. So not once the veterinarian detects the pregnancy in cattle, then the cow left without any further examination until the very end of the pregnancy. So because, as you know, particularly ladies here, in women, the maternal child monitoring health guidelines, particularly in my country, at least 14 times once the pregnancy had detected until the delivery. So I don't telling you that it needed so much times pregnancy check in cattle, but so at least regular checkup in the middle of pregnancy or at the late of pregnancy. So maybe twice or 3 times more as the current status in pregnancy management. So there's also demand for Japanese beef, particularly Wagyu beef in the other countries, Japan. So Japanese government are very keen to increase the export of Japanese beef. So to do that, we need to establish a monitoring system of pregnant cows that should reduce the incidence of dystocia or stillbirth, and we should improve subsequent reproductive performance. Okay, so my talk will be divided in 3 parts. The first is cervical ripening during prepartum period. So why cervical ripening is important? Because, so this is a calving. So usually it is normal calving if the fetus in the head presentation and backward position and both forelimbs are elongated. Let's see. So if it's abnormal, if fetal size is excessive, particularly if the pregnancy period is over the expected days of 290 days, and head or limbs are not oriented straight. So this may be normal, but sometimes, as you may know, so the head rock is not progress of delivery so further. So it may happen, as may cause injury in the birth canal and so on. So there are several different causes in abnormality during late pregnancy and parturition in Japanese black cows. As a breed, bovine breed in other countries, but so as you can see here in this slide, dystocia and prolonged pregnancy accounts for more than 80% of all other causes for abnormality during late pregnancy and parturition. So we focus on the dystocia and prolonged pregnancy, which should lead excessive size of fetus. So the dystocia could lead to stillbirth and death of newborn calves. And 70% of fetal deaths are due to dystocia. And as I said, the economic loss of beef farms in Japan, at least $75 million, and or sometimes it's more than $100 million per year in the country. So what are the causes of dystocia in beef cattle particularly? So as I said, so there are a lot of prolonged gestation, and it causes excessive fetal growth, which accounts for almost 30%. And besides, there is a birth canal abnormality, 20%. Particularly, we focus on these abnormalities. So there is statistics in the recently there has been an increase in the abnormality of the birth canal in Japan. So this may be due to insufficient cervical ripening. We don't know. So we started a research project on the mechanism of cervical ripening. So what is a cervical ripening? So this is a local inflammatory, very physiological inflammatory response. It has no infection, and also presence of macrophage is involved. So these mechanisms of cervical ripening has been reported in several other species. In humans, macrophage infiltration of the cervix is at least doubled during labor. And in rodents, for example, in mice, reducing macrophage during pregnancy prevents cervical ripening. So it means if reduce artificially the level of cytokines or the depletion of production of macrophage, it could prevent cervical ripening. So it means that it doesn't start the delivery. So in rats, pro-inflammatory M1 macrophages increased, and anti-inflammatory macrophage, M2 macrophage decreased in cervical tissue as parturition approaches. So also, several different inflammatory cytokines are involved in cervical ripening. In human, concentrations of inflammatory cytokines such as interleukin-6, 8, and tumor necrosis factor alpha or TNF alpha in amniotic fluid increased before delivery. Also in human, such increase of IL-1 beta, IL-6, and IL-8 in the uterus contribute to the process of cervical dilation. Also in guinea pigs, application of IL-8 in the cervix result in softening or ripening of the cervix. Could you change the new battery if? Okay, sorry. So this is a staining of type 1 collagen. There is a type 1, 2, 3 collagen, but so it has been reported that in mice, the strong staining of type 1 collagen is decreased along with the progress of the pregnancy. And in human, also cervical ripening is caused by macrophages that stimulate that inflammatory cytokines such as IL-1 or TNF-alpha, IL-6 or IL-8. So the stimulation of the inflammatory cytokines on blood vessels caused inflammatory cells to degrade the extracellular matrix, type 1 collagen, resulting in softening and ripening of the cervical canal. But in bovine, in cattle, there is very little report or literature exists. The only report, almost only report, has been reported recently is the increase of IL-8 along with the progress of pregnancy, and also infiltration in the endometrium in the late pregnancy. So that's why we wanted to elucidate more detail of the cervical ripening in cattle. So we took some samples from 41 Japanese black cows in our university farms, and we took samples as mucus, cervical mucus and cervical tissue by biopsy. So as you can see here, from 200 days of pregnancy, 230, 260, and then once a week, we took cervical mucus as well as cervical biopsy samples until the calving. So we collected mucus samples by hand by inserting the hand into the vagina, in the vulva, in the vagina, and took samples and smeared on the slide and stained with Diffquick so that we could calculate the percentage of polymorphic nuclear neutrophils, or PMN, in all nucleated cells, or PMN%. And in the tissue, we took biopsy by biopsy punch, as you can see here in the left hand of the slide. And then the samples were fixed in formalin and paraffin embedded, and took the serial sectioning, and also multiple immunostaining with 3 antibodies as shown in this slide, and anti-IVA1, anti-INOS, and anti-CD163 for the target all macrophage or M1 macrophage or pro-inflammatory, or M2 macrophage or anti-inflammatory. So the macrophage infiltration was calculated as the percentage of all area stained with anti-IVA1 antibody over the total area. And the macrophage types were estimated as the expression ratio of INOS or CD163 in the expression region of IB1, or all macrophage analyzed to estimate the type of macrophage. And the software ImageJ was used to analyze those percentage. So, and also the real-time PCR was conducted in tissue and mucus. The protocol shown as in this slide to homogenize the tissue mucus in RNA using this machine as shown in this slide. And the total RNA was extracted using Torizol reagent. And then delta CT method was used to calculate the ratio of messenger RNA expression levels using based on the 200 days of gestation was calculated. Also, cervical mucus was extracted for protein in PBS, and protein concentration was measured by absorbance using the nanodrop device. And IL-1 alpha, beta, 6, 8, 10, and TNF alpha concentrations were measured by MagPic system with this magnetic fluorescent macrophage. And then the concentrations of each cytokine divided by the protein concentration was used as a measurement value. So this is one of the first results we got. As you can see here, if you look at the profile of PM% during the late pregnancy, so it increased in PM% at 5 weeks before the calving, and then keep increasing until 1 week before the calving. So we just found that this profile was consistent with other animal species like humans and rodents. And also, type 1 collagen changes was similar to mice. From day 20 to 100 days of pregnancy to 260, 288. So the staining would become weaker, and so as you can see here, type 1 collagen in cervical tissue decreased by 274 days in pregnancy. Also, macrophage was not found at 14 to 12 weeks before calving, but it was found or observed by 6 weeks before the week of calving. So the image is shown in here. Stained with the respective antibodies and merged together in the region of IBA1 expression in the middle of the slide upward, and it was correlated, very strong correlation was found with this INOS antibody or M1 macrophage, but not with M2 macrophage. So it means the very strong correlation was found. So as to the various messenger RNA expression of the inflammatory cytokines, as you can see here, IL-6 was increased at the week 3 before the calving. So that among the other cytokines, there is no such increase. Also, this is tissue, and this is the cervical tissue. But this, in the cervical mucus, there's no significant increase in IL-6, but IL-1 alpha and IL-8 increased by week 3 before the calving. So this is the cytokine concentration, not messenger RNA, but also the similar trend was found, like IL-1 alpha, IL-1 beta, and IL-8, and TNF alpha was increased by week 2, 1, or week of delivery before calving, but not IL-6. And also IL-10, which is anti-inflammatory cytokine, was not increased. So to summarize these results, so M1 macrophage increased by week 6 to 5 before delivery. So, and then this MR macrophage produced IL-6 in the tissue during cervical ripening in cattle. So, and there's a consideration that IL-6 triggers inflammatory response, and the presence of MR macrophage here may trigger cervical ripening. And as you can see here, there was an increase in IL-6 in the tissue, but not in the mucus. So no change in IL-6 messenger RNA expression, and increased IL-1 alpha and IL-8 messenger RNA expression, as well as concentrations in cervical mucus. In particular, IL-8 shown in the upward in the right side showed a marked increase in both messenger RNA as well as protein concentration. So cervical ripening process in cattle so far we found was IL-6 triggers a local inflammatory response by initiate cervical ripening. So MR macrophage produce several cytokines, particularly IL-6. So this IL-6 act on blood vessels to infiltrate inflammatory cells and promote inflammatory cytokine production. And inflammatory cells and cytokines migrate with mucus with a lumen, as you can see here, increasing IL-8 in the mucus and migration of neutrophils. So that these increased neutrophils make type 1 collagen decrease towards the end of the delivery or the beginning of cervical ripening. So that as my second part of my talk is involution of the reproductive tract during early postpartum period. So lochia, what is lochia? Lochia is derived from residual placental fluid or hemorrhage and placental tissue that has dropped off. And so usually if the normal lochia has no odor, for odor, or the color varies a lot. For example, cow A, here, shown here, at day 5 postpartum is a bit dark color, but became very whitish by day 17 postpartum. But other cows, like cow B, is reddish to become chocolate or brown, and then turning to glassy mucus or grayish white sometimes. So what is the difference between these different animals? So we focus on the lochia because this is a kind of vaginal discharge. So we wanted to determine the level of cytokines in lochia samples or vaginal discharge mucus. So we took some samples from dairy cows in a large dairy farm located in Oita Prefecture in Japan. And so the sampling protocol, as shown here, from 2 days, 5 days, 9 days, or 16 days postpartum, we took lochia samples and cytokine messenger RNA expressions were measured for interleukin-1 alpha, beta, 6, 8, 10, and 10 alpha. Also, we took some endometrial samples to measure the PM% as well as the cytokine expressions at week 5 postpartum. So lochia samples and endometrial samples at week 5 were collected as samples. So this is how to take the lochia samples, as we took the mucus sample the same manner, washed with disinfected solution and alcohol spray. Okay, and this is how to take the endometrial samples using the site brush as shown here. through the cervix and smear samples, and also, as I showed you, to calculate PM%. And cutoff point for diagnosis of endometritis at week 5 is put as 6%, according to the report by Dubuc et al. So this is some of the results we got. So as you can see here, there is a pointer. If there is a pointer, another one you have? Okay, sorry. This is the pointer. Okay, so if you look at this bar with sharp lines, this is cows with endometritis, and this is a black bar is cows without endometritis. If you see the endometritis cows, the increase in IL-1 alpha and IL beta and TNF alpha from day 5 to 9 and to 16. In contrast, without endometritis cows, so from day 5 to 9, all increased, but decreased from day 9 to day 16. So this is the same trend we found. Okay? And if you compare the level of cytokine messenger RNA expression between cows that conceived after first artificial insemination postpartum and not conceived by that insemination. So this is a blue bar indicates cows that conceived. So as you can see here, from day 5 postpartum to day 9 increased and then decreased by day 16. So this is the same trend in IL-1 alpha, IL-1 beta, and also IL-8. But in contrast, cows that not conceived by the first AI postpartum, it kept increasing from day 5 to day 16. This is all the same trend. Okay, so this is a comparison between the cows that had endometritis at week 5 and no endometritis at week 5 postpartum. So this is a level of cytokine messenger RNA expression at week 5 postpartum. So it is very clear that these pro-inflammatory cytokines had a higher expression in the cows with endometritis compared with those without endometritis. So in summary, at this stage, the inflammatory response up to about 16 days postpartum and subsequent incidence of endometritis, we could say that if cows resume normally in the uterine involution, transient increase was observed by day 9, but decrease, it resumed to normal level by day 16. But if cows developed endometritis, the inflammation became worsened or became greater along with the progress of days postpartum. So this is the last part of my talk. Will be pathogenesis of clinical and endometritis and subclinical endometritis. So as you may know, there are several factors that related to development of endometritis, like low glucose or or sometimes heat stress and dystocia and several different bacteria. So if cows in the postpartum period in the healthy uterus all of the cows in healthy as well as pathological conditions, there is inflammation at the early postpartum period, but by week 4 or 5 postpartum, there is a physiological inflammation followed by the expulsion of lochia and vaginal discharge, and uterine involution has been completed by that time. But due to these factors, some cows develop inflammation of the uterus or endometrium or endometritis. Okay, so inflammation and infection of the reproductive tract in dairy cows got purulent vaginal discharge or cytologic evidence of inflammation affect up to 40% of all dairy cows in the postpartum period. And each, so 15 to 20% of each form has a clinical or subclinical endometritis. So, but fat is unclear was that fat leads to one form of the disease to the other. And so at the moment, there is no diagnostic test for the field or practical use, only detect part of the problem. So it means usually, so some practitioners or veterinarians in bovine practice use a Metritis check to take the vaginal discharge from the vagina in front of the before the cervix. So it means you can see only the pathology of in the cervix. In the vagina. But if you use cytobrush shown here, you could see the pathology of the endometrium or in the uterus. And so the pregnancy diagnostic test, only the one part of the problem can be observed. So traditionally, the concept of the clinical endometritis was a part of subgroup of cytological endometritis. But it was not true because my colleague Dubuc is currently working at Montreal in Canada, showed about more than 10 days, 10 years before, showed only 42% of cows with purulent vaginal discharge had cytological endometritis. Means here, out of the 334 cows, only 139 cows had cytological endometritis. So all forms of gross cervicitis were associated with cytological endometritis. And nearly 60% of cows with cytological cervicitis had endometritis, and only 12% are among cows without cervicitis. So it means cytological cervicitis is related to endometritis. But yet, a little bit more than 50% of cows with endometritis had not cervicitis, and more than 40% of cows with cervicitis did not have endometritis. So it means so the inflammation in the cervix and the inflammation in the endometrium had different pathology, different conditions. So there is an overlap condition, but it's also different pathology may have. So each of these inflammation may occur independently. So also what we found in our study that if the cows without infection with Trupella pyogenes at week 5 nor week 7, only 9% 0.4% of the total cows had cytological endometritis. In contrast, so in those groups, the cows infected with Trupella pyogenes, both at week 5 and week 7, most of them, or 90% of the cows, had cytological endometritis. It was nearly 10 times more than those without infection caused by Trupella pyogenes. So this is also what we found was if you look at the cows positive for bacterial infection, it means bacterial infection, either Trupella pyogenes or E. coli, Escherichia coli, had a higher PMN% at week 5 and week 7 compared to the cows negative for bacterial infection due to such bacterial species. Okay? Also, when we look at some biochemical parameters in the blood, so what we found was if you look at the glucose level at prepartum period, week 3 or 1, before calving, had, sorry, this is not, the pointer is not working, but here, at the cows infected persistently for, due to E. coli and or Trupella pyogenes had significantly lower glucose level than other groups which had no infection by E. coli and Trupella pyogenes. Okay, thank you. Okay, thank you. So when we look at the luteinization or ovulation, first ovulation postpartum by 49 days postpartum, so if you look at the week 5, so this is a PN%. So those groups that had ovulation by 49 days postpartum had a significantly lower PMN% compared to those that had not ovulation or luteinization by 7 weeks postpartum. Also, when we look at the Japanese black cows, the day 0 is a day of time to AI. So if compared between the cows that became pregnant after the first time to AI and then not pregnant by time to AI, so the level of PM% at 10 days before the time to AI, 3 days before the time to AI, and 4 days after the time to AI, all of these had lower PM% than those that did not pregnant. So it means so PM% level at the before and after the time to AI is related to the outcome of the pregnancy. So the last part is, so heatosis is another factor affecting the uterine environment. Recently in Japan, there is of course, all over the world, there is a heat stress during, if compared 100 years ago, it was about 1.5 grade Celsius increase recently. So the heat stress has become problem. So when we look at the several different bacterial species in summer and in spring, there's a different composition of different bacterial species. For example, Trupella pyogenes, Escherichia coli, and Prevotella are thought to be the, pathogenic to the endometrium. But if you look here in the spring, so the cows in spring, smaller percentage of cows had Trupella and E. coli and no Prevotella. So it means maybe the temperature is a factor that affects the development of endometritis. Okay, So if we look at the cytokine levels between the in spring cows and summer cows in here with this orange bar, and cows with endometritis in spring here and without endometritis here. So no endometritis cows do not show much change in spring and summer, as you can see here in the spring. But endometritis cows show greater expression of inflammatory cytokines in summer than in spring, as you can see here. Okay, so when endometritis develops during the hot weather, the inflammatory response became greater. So in summary, IL-6 triggers a local inflammatory response and initiates cervical ripening in cattle, and IL-8 plays an important role in the local inflammatory response in the final stage of parturition. And profile of cytokine expression in the reproductive tract during the first 2 weeks postpartum may be a predictor of subsequent risk of endometritis. Also, clinical endometritis has a different pathogenesis than clinical endometritis. And persistent Trupera pyogenes and E. coli infection after 5 weeks postpartum increases the severity of endometritis. And prepartum hypoglycemia or a low glucose level worsens the postpartum endometrial environment. And endometrial inflammation up to 5 weeks postpartum delays first ovulation postpartum. And endometritis may be aggravated during hot season. Okay, so the conclusion is here, prepartum management to prevent glucose deficiency, normalizing cervical ripening, physiologic inflammatory response during early postpartum period, prompt diagnosis to identify causative agent and intrauterine inflammation level are all beneficial for tackling postpartum uterine diseases and improving reproductive performance in bovine herds. Okay, so our goal is selection of useful tests to reduce prevalence of perparturient diseases in cows and increase number of calf production in a maternal and calf health checkup program. So we aim to develop a maternity health record book. And finally, we hopefully develop a handbook apply using the cell phone or smartphone. Okay, so acknowledging all of these involved shown here in this slide. Okay, so this is my end of my presentation. Thank you. Gracias. Muchas gracias.
Thank you, Dr. Osawa. Congratulations for your work. No have time for question.
Okay.
Sorry. The next presentation is, in the next section of presentation, each speaker will have 15 minutes for their presentation and 5 minutes for question. The next presentation is main bovine respiratory infectious agents identified on stethoscopes and boots from 12 rural veterinary clinics, presented by Geert Vertenten from Netherlands. Thank you.
Thank you for the introduction. I don't know how many practitioners are here, but I think I make it a bit practical. Yes? No hablo español. So apparently my slides didn't come through, and I have no copy, no USB stick, but I will anyway entertain you, so no worries. First question, well, who arrived outside Mexico was landing with a plane or maybe arrived by boat? I did. What did you get at customs? A landing card. There were things on taxes. There were questions on disease agents. Do you remember? There was one question asking, do you bring disease agents into Mexico? What did you answer? I did no. How sure are you about this? Did you take samples of your hands? Wondering also about this clicker, if there are infectious agents. I don't know. Did you sample your clothes, your luggage? But other question, I wanted to address this presentation to practitioners. How often you disinfect your stethoscope? Your boots? I'm from Europe, so I know practitioners, they have busy days, they go from one farm to another. Do they disinfect the stethoscopes in between visits? I don't think so. Do you think there are infectious agents on the fomites, on the materials? Well, that's what I've done in my study, and I won't show you any graphics, but I will definitely describe it. Did you ever, maybe, not yours, maybe of a colleague, take a sample of the steering wheel of your car? Maybe of your laptop? I think it's plenty of infectious agents. At least that's what I was thinking, even if I go in literature. So we set up a very small trial. We had a working group in France, very nice practitioners. And we said, well, after 1 week of practice in the weekend, if you have duty, maybe sample the boots of your colleague. Take a sample, a swab of the stethoscope. So that's what they done. Because we know from a few publications from Dr. Oma, she's a Veslome Oma, is a researcher at Oslo University, and she looked at fomites, so overalls, boots, and she could show that infectious agents, respiratory agents were there as BRSV, bovine coronavirus, on many of those equipments. And the example of bovine coronavirus, it stayed infectious for at least 24 hours. So having this in mind, well, I'm sure we as vets, we're spreading happily infectious agents from one farm to another. I've been on farms in the Middle East, very firm biosecurity. But I also know the farms in Europe where, well, we have open days. Consumers can come in, can go out, so the hospitality is very good, but it's not without any risks. There's definitely a risk of indirect transmission of respiratory agents by material, and the human vector cannot be underestimated. So, I will describe the materials and methods. I'm happy I printed it out. So, that working group, we had vet from 12 rural practices, and we included them in the study in December 2022. And we took samples on each veterinary practice, as I said, at the end of the working week. So the guy on duty had nothing to do, so some samplings, why not? But we also had a short questionnaire to make it a bit more substantial. And we asked them the number of farms they visited in the last week, and also to highlight more or less which herd had problems with scours, neonatal calf diarrhea, and bovine respiratory disease. We also asked when was the last time that the boots and the stethoscopes were disinfected. Just think about yourself. When was the last time? Maybe boots is not so bad, but the stethoscope, huh? Remember, you have a BRD calf, very practical, you want to help the farmer. You put your stethoscope, you hear sounds. I don't know what you hear, because we know from other studies that sensitivity, specificity is 50%, but it looks nice. It's very professional. If you have a picture of a vet, well, he's in a white coat with a stethoscope. So it's an important thing. Don't underestimate it. Anyway, I'm drawing off here. But so we had then 2 to 4 pairs of boots and 2 to 4 stethoscopes by practice. We pooled the samples, and those samples were sent to an analytic lab in cool transport, so within 24 hours of sampling. So they were sent to the Lab Océa, which is a French lab in Brittany. So we did the PCR, or the Lab Océa, the lab did it, for 12 BRD agents. So we looked at BRSV, bovine respiratory syncytial virus, bovine coronavirus, parainfluenza 3 virus, Mycoplasma bovis, Mannheimia haemolytica, Histophilus somni, and Pasteurella multocida. So not bad, very straightforward. And now, well, I cannot show the graphs, but I will bring you through. I can tell a lot of those samples were positive for one or another virus, bacterium, or combinations. Shortly, well, for the stethoscope, 75% of the vet practice had at least one infectious agent on their stethoscope, based on PCR. If it's really infective, we don't know, but of course, it tells you something, there's genetic material of one of those infectious agents. And the boots, a bit better, 50% of the vet practice had at least one infectious agent. So we know while we rinse our boots, not really disinfect, so this is, if you put it in context, it's a better situation, but the stethoscope, I think this is terrible. Again, why do we need stethoscopes? I don't know. But it was my first thing at vet school. I was so proud to have my stethoscope. I probably still have it, but I never disinfected it. So the most frequently detected viral pathogen, guess. Well, bovine coronavirus. I know some people are still asking, is bovine coronavirus part of the BRD complex? I think we now should include it. I've seen presentations, keynote lectures, they didn't mention it. I think it's a mistake. The most frequently isolated viral BRD pathogen, it's bovine coronavirus. Probably thanks to the veterinary practitioner. I don't know, didn't say that. But I remember when I was doing my PhD at Ghent in Belgium, at university, I was part of the veterinary clinic. We had calves with BRD, we were sampling, and we found bovine coronavirus 20 years ago. I was looking to my colleague of internal medicine. He was saying, it's an artifact. It doesn't mean anything. It was hard to find it. It was maybe 5% of the samples. Now we're 15, 20 years later, we find bovine coronavirus in some farms. I think if you go to field farms, in 100% of the farms. Respiratory cases, it's very often. So just to tell you, maybe over the 20 years, thanks to not disinfecting stethoscopes and boots, we made it happen. Well done. Then the most frequently detected bacterial pathogen, guess? Oh, it's not so hard. Pasteurella multocida. Okay, whatever. Just checking my slides. What do we have more? Okay. Between 5 and 46 cattle farms have been visited during the week, the working week, or no, during 72 hours before sampling, to put it in perspective. So that means that during one day you do 12, 15 farms, knowing that 75% of the stethoscopes are infective or have infectious agents. I'm sure that we happily share those pathogens. 100% of the boots and 40% of the stethoscopes were disinfected during the 30 days before the sampling. 30 days. So we do it every month, disinfecting our boots. Maybe you better buy some new ones, huh? Anyway. So it was, disinfection was 1 to 14 days prior sampling for boots, so that's a variation. So not too bad, but 10 to 20 days prior sampling for stethoscopes. Again, I repeat, if you go into literature, we really underestimate how we can spread disease agents. I would like to share a publication from Dr. Oma. You can find it in the literature, where she said, well, the long-lasting bovine coronavirus shedding in infected cows is up to 24 days. Humans are carriers not only in the nostrils, because that's also part of it. They stay not very long infective in the nostrils. I think it's a few hours, but still. But on fomites, it goes until 24 hours. So again, I would like to address the importance of biosecurity. Do we continue stimulating on farmers to have open days? To invite consumers to show how nice their dairy farm is? I think you can, but well, be aware that biosecurity measurements are very important. I think it's something we cannot underestimate. If we continue doing that, we make things worse. And that the example was the bovine coronavirus, which is now spread worldwide as a respiratory pathogen. Nobody believed me, but thanks to COVID, I think people start to believe in it. I also found out that Norway, which is, well, a pretty different country than many other countries, they have a voluntary program to eradicate BRSV and bovine coronavirus. I think it's very brave. Probably they can do that because they have pretty small-scale farms. But do you think it's possible to eradicate BRSV and bovine coronavirus on a national level? Maybe with vaccination? No, just kidding. I think it's hard if you realize what I just described, that the infectious material stays on your stethoscope, on your hands, and many other fomites. But again, let's put things in practice. Next week, we all go home. Maybe some of you are on duty. Take some samples from your colleagues' boots. From the steering wheel, from the bricks refractometer, from your syringes, from your overall. There's enough things to sample. But I would definitely encourage you to do it sooner or later, because you will really see what damage we can do and how riskful we are. And I hope I'm here in a very secure environment, and I can tell to you as veterinary practitioners that we are, well, maybe a cause of spreading disease. It's something we can avoid, we can take measurements, but make it visible for yourself, for your colleagues. Maybe don't talk too much to your farmers that you, the last 10 years you spread and you introduced viral and bacterial agents on their farms. But of course, it's job security. Thank you very much, and if you have questions, please let me know.
We have time for one more questions. Any questions? I have a question.
Okay.
What additional measure could be implemented to improve biosecurity in veterinary clinics, and how could this measure?
Yes. So yeah, additional biosecurity measures in vet clinics and farms. I think it depends which kind of farms you're working with. I mentioned farms on in the Middle East, which are closed, difficult to enter. So external biosecurity is very high. Compared to farms in other parts of the world where they have open days, everybody can freely come in. Even while me, as a person of a pharmaceutical company, I try to give the good example and have clean clothes, overalls, but I know that's not always very practical. We know also there's a system from Ghent University, BioCheck, where you can check internal and external biosecurity on the farm. It gives you a score, and it's available for beef, for dairy, for veal, but also for poultry. And and for swine and other species. If you compare the biosecurity scores of cattle to other industries, scoring extremely low. So there are many ways to improve biosecurity. I understand we're not, let's say, a pork farm, a chicken farm, but maybe that's the way to go. That's the future. And then if you ask me which measures we can take, well, I can easily give you a list of 100 on each farm. We can improve. Of course, that's too much, so maybe try to identify 3 to start with, things which are achievable, possible, but do that together with a veterinarian and a farmer, make it practical, because on each farm, there are many ways to improve biosecurity. Thank you.
Thank you, Doctor. Any questions? No? Thank you for your presentation. Thank you. Thank you. The next presentation is a characterization of the lower respiratory tract biome in dairy cows with and without clinical respiratory disease signs, presented by Kerli Motus from Estonia. Thank you. Go back.
Do you have a pointer?
Yeah, pointer.
Yes, thank you. So hello, everybody. Thank you, organizers, for inviting me and giving opportunity to share our work, and the listeners who are here to listen to me. So to start with, I come from Estonia. So small recap, where is it really? It's a very small country, so I don't blame if you don't know anything about Estonia, but here it is. It actually really exists. So it is here, north of Europe, very small country. You see, we don't have very many people, just 1.3 million, so we are quite endangered species, I would say. We don't have many dairy cows as well, only 83,000, but we like to say these cows are quite special because they are the highest producers in Europe, and we are very proud of that. But on the other side, there are things not to be so proud about, and that's our infectious disease status, because we have everything you can dream of. If we talk about BRD pathogens, we have IBR, BRSV, BVDV, everything you can dream about. So for me, scientifically, it's very interesting to population to do our studies, because you can really find out how the pathogens interact and whether there are actually other pathogens in addition to these major ones we talk about every day. And these farms are also interesting in the sense that they are quite modern. The biggest part of our dairy cows locate in these quite nice, fancy farms, large-scale farms, we say, not, of course, in US context, they are still small, but in our context, they are the quite intensive production systems managed by the farm managers and the waged labor. So, introduction, BRD, we all know it's quite devastating disease, causing a lot of welfare problems, health issues, economic problems, but also triggers us as veterinarians to use a lot of antimicrobials. So this is definitely something we need some solutions. And can you wonder, today we have more knowledge, more vaccines, more treatments available, but if you look at the trends, then the trends are very worrisome. The BRD is getting worse and worse and worse, and we don't see much solutions about that. Have you thought about that? So, one thing is the risk factors for BRD. Of course, our farms are changing, they are intensified, etc., etc. But on the other hand, maybe there is a problem that we have overlooked some pathogens. And within the last 10 years, there has been used a lot of these next generation sequencing methods. So what is it? It's like a black box. You collect a sample from a calf, and you put it in the black box. You don't order, please, look whether there is PRSV, whether there is PVDV. No, we don't tell the machine what to look for, but the machine basically tells us what is there. So this is like an unbiased approach to look at the pathogens, isn't it? But how much we do it? Probably not much. But this is, for example, how COVID in humans was found out, that, okay, there is a nice new pathogens new coronavirus involved. Okay, but there are few metagenomic studies done also in calves, in cattle, about BRD samples. And you know what? There are not very many these major pathogens involved, like BRSV, BVDV, IBR we talk about today, yesterday. But there are new viruses that we don't even know about. And this was also our aim, to look at these pathogens, to explore the dairy calf virome in the lung level, because we do know that the viral and microbiome communities are very different if you take the nasal swab or deep nasopharyngeal swab, or if you take the lung lavage. So we decided that we are most interested about the lower respiratory tract problems, because this is what we should treat in a regular practice, not just like rhinitis. So that's why we concentrated on the lower respiratory tract pathogens, and we wanted to broaden our understanding of the virome, what is actually there, what is going on. And of course, the threat is that you put the sample into the machine, and the answer it gives you is a huge list of different viruses you have never even heard about. So the next question is, okay, but which ones are pathogens, and which ones are just normal habitants? And that's why we wanted to know, okay, which pathogens have the clinical relevance, meaning that the calf really shows some kind of BRD symptoms. And also, what is not done so far, according to my opinion, is that which infections induce inflammatory response, because we know that quite many calves suffer also subclinical pneumonia even. So we wanted to see, okay, but which ones really cause any increase in the acute phase proteins and cytokines. So very briefly, a few years ago, we visited 20 large-scale dairy farms in Estonia. In each farm, we scored the calves based on the clinical signs, and we selected 5 diseased calves showing some BRD signs and 5 healthy ones. And from these calves, we recorded the clinical signs. We took the blood samples and BAL samples from the lung level. And the BAL samples were microbiologically cultivated to analyze the association between the viruses. We also have to account bacteria, because they also cause a lot of problems and inflammation. And we did PCR testing for the Mycoplasmopsis bovis. It's a new name for Mycoplasma, so very inconvenient, but new. And these BAL samples were actually put into this black box as pooled samples, because it's rather expensive to do that, quite laborious to do that. And the idea was that, okay, we use pooled samples, farm-based pooled samples from healthy and diseased ones, to filter out some possibly interesting viruses. And these interesting viruses were looked on individual calf level using PCR. So it's like more precise, more quantitative method to actually find out how much there is this virus. And BAL and blood samples were analyzed for the acute phase proteins and cytokines, and we did some regression models to find out the associations between the identified pathogens and the immunological response and clinical disease. So here are the results. As you remember, we put to the black box the pooled samples. So to filter out some viruses which were more common and in higher quantities in the samples. And eventually we could restrict the viruses into 9 pathogens. So let's take on the family level. So we all know coronavirus 1, beta coronavirus 1, which was just mentioned in the previous presentation. But also, like, our eyes were quite wide if we looked, okay, there is the COVID-19 virus also present in calves. So we still think it's a possible contamination in the laboratory, because with the same machines, they analyzed the COVID samples previously. But why I didn't delete it? Because if you read recent EFSA reports, then actually in calves, in cattle, there have been seroconversion for COVID-19. And also, it has been detected in the nasal swabs. The RNA has been detected in cattle. So that's why it's possible contamination, but I don't ignore this finding. It should be identified further whether it's really true or it's just pure contamination. From the B. Coronaviridae family, we see, maybe you have heard about the two first ones, so bovine rhinitis A and B viruses. They are actually found out in many, many countries, including in Mexico. I checked. But the new virus, which I have never heard about, is the poppyvirus A. And from the Parvoviridae family, we see 3 viruses, the Coppyparvovirus genus. And these have been found actually previously, but none of the studies have found out that they are like major pathogens. And adenovirus 3, the other name is bovine must adenovirus B. It was also very common in the samples. So they are the pooled samples. So we decided, okay, we check these on individual calf level as well to see what they cause. So these results are presented, but at first the prevalence on individual calf level. So in the end, we have 201 calves from these 20 farms, and you can see that the most prevalent ones are the ungulate Coppyparvovirus 1 and bovine rhinitis B virus. Quite substantial prevalence on individual calf level. And coming one by one, this ungulate Coppyparvovirus 1 actually has quite many phases, although not frequently found, but found in US and possibly even in Canada. A few references about that are available, and it has been identified in the diarrhea samples of calves and also lung necropsy samples, but also in the fetuses. So because it also has the vertical in addition to horizontal transmission. These other 2 Coppyparvoviruses with a quite low prevalence have been actually detected in US from the calf serum samples. If they have just like checked the serum samples for different viruses with this metagenome analysis, they have identified these there, but nothing can be found on the pathogenicity of these viruses. Bovine rhinitis B virus, very, very prevalent in all over the world, including Mexico, US, Europe, China. And this is actually the only one in this list which has been shown previously that, okay, this is really associated with a respiratory disease clinically. And with bovine rhinitis A virus, it's also quite often reported in metagenome studies in cattle, but still it hasn't been confirmed whether it's a pathogen or not. And the last one, this poppyvirus A, I found only one reference in Hungary actually, where it was detected in calf diarrhea samples. So you see, our farms are endemically infected with IBR, BVD, BRSV, but they don't appear here at all. So this was the first surprise to me, that actually in endemic conditions, in endemic disease, they are not the main contributors, but we have something else. So this really opened my eyes that we should look actually on a wider scale about our pathogens. Because you are all practitioners, maybe you also feel similar things, that you take samples from the calves, you send to the laboratory, you tick for the major pathogens, and you don't find anything. Have you felt that? I have felt that very often. And then I think that, but maybe we have overlooked something. Okay, but let's proceed. Which of these viruses were actually related with a clinical disease? So clinically diseased calf was the one which showed the fever and or increased respiratory rate, because the other signs are not very indicative of the lower respiratory tract disease. So what we found out that this ungulate Coppyparvovirus 1 was significantly associated with a real disease signs in the calves. Contrary, bovine rhinitis B virus was more prevalent in healthy calves. So these were the 2 most prevalent viruses, but very different phases. Let's move on to the inflammatory response. So we detected acute phase proteins and cytokines in the serum samples, but also in the lung samples, the bulk fluid itself as well. And you see that these results differ a bit. So if you take serum amyloid A, which is very well-known acute phase protein, then only the ungulate copy parvovirus 1 showed some tendency of the increased SAA levels. But of course, in the models, we controlled the bacteria, which significantly also contributed. So yes, we can conclude that this ungulate copy parvovirus 1 could be a pathogen causing clinical disease. But let's look at the lung level, because we detected some cytokines. The one very interesting cytokine is bovine monocyte chemotactic protein. So what it's doing, it's increasing in the very early phase of the disease and invites monocytes, please come, we need some work to do here. So which viruses were related with this chemokine? Actually, what was interesting is that the same copy parvovirus 1 was associated with a lower concentration of this chemokine. So taken together, can you think about it? This virus was associated with clinical disease, systemic response, but lower local response. So it gets head around, but still, if you think how we selected the calves, we selected them on a random time point. We went to the farm, we checked the calves, and selected based on the clinical signs. But we all know that clinical signs appear a bit on a delayed phase of infection. Do you agree? But this local systemic response is in the very early disease phase. So that's maybe an explanation why we see this kind of contrary or vice versa associations. Bovine rhinitis A virus was actually increasing this bovine chemotactic protein. And we also looked on the lung level, the serum SAA levels, and the same pattern actually appeared. And you see that this ungulate copy parvovirus 1 is showing signs in the calves, increased systemic SAA level, but lower SAA level in the lung. So I think that's explanation for this could be really that the selection of the calf was based on clinical signs. Okay, so what are our conclusions? The first conclusion is that viruses that are typically associated with BRD and we talk about every day were not detected at all in endemic situations. And in endemic situations, we possibly have totally different viral profile contributing. And we identified very novel viruses. Ungulate copy parvovirus 1, it was associated with the clinical respiratory disease signs and triggered the systemic inflammatory response. Bovine rhinitis B virus was more prevalent in healthy ones and didn't cause any systemic or local inflammatory response. And bovine rhinitis A virus was associated with local inflammatory response. So there is a lot of things the study can't answer for, but there are a lot of hypotheses that should be checked further. And of course, we have some limitations in our study, so we don't know the time at infection. If we go to the farm today and sample calves, we have no clue in which disease phase they actually are. And this is the main limitation of the study, making conclusions a bit difficult. And we don't know anything about whether the healthy group maybe had subclinical pneumonia, because now we know after using the lung ultrasound that the subclinical pneumonia prevalence is quite high in Estonia. So there are a lot of limitations, but still this is like the first insight to these pathogens and providing a lot of new hypotheses to control in our further studies. So further perspectives, possibly we should establish the pathogenicity of these new viruses. And also, probably, I really expect that in 5-10 years, we as veterinarians can send the samples for the black box analysis and not choose the PCR, which is a biased method. For example, in Estonia, we have a very good collaboration with Belgium colleagues, and they run the samples for the veterinarians already today, the sequencing results. And they help to interpret the results as well, so you are not like facing 30 viruses with no clue what to conclude about. So I think these metagenome studies will broaden our view about BRD totally in the coming years, and maybe in the next conference we talk about it more. Who knows? So I want to thank our colleagues actually in Finland who did all the laboratory work. I thank the farmers, veterinarians who were involved in this study, and the funders and others contributing the data. So thank you a lot. If you have any questions, I would be happy to take them.
Thank you. We have time, one questions.
Was it actually BAL samples you took, or was it more tracheal wash? And the second, all the viruses you found are not covered in the commercial vaccines. Do you think the vaccines we are using are more or less without any effect, useless?
Thank you for these two questions. So the first one was where the sample actually came from. So it is correct term is not the bronchoalveolar lavage, because we think we don't reach to the alveoli, definitely, and that's why the synonym TBL is more often used. So it is a tracheobronchial lavage, actually. So the sample, the wire is about this long, so it goes to until it stops. So where are we? We are probably in main bronchi, but in a random lobe. Of course, we don't know where we actually are. And this is one limitation of these blind techniques, because we don't eventually know in which lung lobe we actually get the sample from, whether it's the diseased one or not so. But still, it flushes. The volume is 40 ml, so it flushes the region, and you get the sample. But yeah, I kind of agree that one limitation is that we don't know exactly where the sample comes from. The second question about the vaccines, I can't definitely say that the vaccines we use are useless, because we use them when we get the disease, isn't it? When we identify the pathogen. So I think none of the veterinarians just blindly buy the vaccine of BRSV or BVDV without getting any laboratory results. So it's a good practice. But I think, and I prognose, that once we get more studies about these metagenomes, and we identify the same pathogens, and they really show also the contribution, the clinical contribution, then possibly there is a room for the new vaccines as well.
I hesitate because you said only one question, and there were always two, already two. But thank you for this very interesting presentation. I've also two questions, if I may. First, we did in the Netherlands also next generation sequence on lung fluids, and it appeared that sometimes the PCR is more sensitive. So sometimes we found BRSV in the PCR and not in the nanopore or the next generation sequence. So I'd like to invite you to react what your experience is in this case. And another thing to look forward, could it be thinkable that some viruses have some protective effect? I heard that we as humans, we carry 10,000 virus or something. Maybe I'm interested in your answer.
Yeah. So the comparison between metagenome approach and PCR, well, the sensitivity and specificity, well, we haven't compared. So we could do it if we send the samples also simultaneously to PCR, but that's related with a high cost, so we cannot at present afford that. But definitely it's an interesting thing to look further. And the second question was about, I already forgot.
The protective
effect of some viruses, definitely. And of course, we should not limit only on the virome, but the microbiome also. And this is actually what our new started project is going to do. And we also have a longitudinal study coming on the autumn, where we actually look the calves from birth up to weaning. We scan them all the time, not to miss these subclinical diseases, etc. And we also test them repeatedly for the full microbiome, including virome as well. So I think we get more answers from that study, but this is just like the first insight what we have at all. So it's like more like a prevalence study, not confirming much of the pathogenicity, but still giving some new ideas, new hypotheses to control further. So after 2 years, I definitely have more information about it.
Thank you for your presentation. The next presentation is effect of tulathromycin metaphylaxis on the nasopharyngeal microbiome, resistome, and Mannheimia haemolytica isolation in cattle, presented by Amelia Woolums from USA. Thank you.
Thank you very much to the organizers for inviting me to this wonderful conference. And so today I'm going to be speaking to you about Mannheimia haemolytica, bovine respiratory disease, and metaphylaxis. Of course, everyone probably in this room knows that BRD is a common problem in cattle around the world. In the United States, it is the most common cause of sickness and death in feedlot and stocker cattle, and Mannheimia haemolytica is the bacteria most often isolated from cattle with this problem. In the United States and also in Canada, probably also in Mexico, mass antimicrobials at arrival, which we call metaphylaxis, reliably decreases BRD morbidity and mortality in cattle at high risk for disease. And I just want to say quickly that the term metaphylaxis is used differently in Europe. And so in North America, we administer the long-acting antimicrobial when we expect the cattle are likely to have the population has members that are affected and members that are going to be affected, but we don't at this time have any requirement to confirm for sure that there's disease. There are 11 antimicrobials labeled for treatment of BRD due to Mannheimia haemolytica in the United States, and historically, antimicrobial resistance in Mannheimia haemolytica has been rare. However, since 2011, there have been increasing reports of multi-drug antimicrobial resistance in Mannheimia haemolytica, and that is defined by resistance to 3 or more classes of antimicrobials. 2 independent reports came out pretty close together in time that described a high prevalence of multi-drug antimicrobial resistance in Mannheimia haemolytica in cattle 2 weeks after metaphylaxis. And the top report is from a group of researchers at the University of Georgia. The bottom report is research that we did at Mississippi State University. And these reports raised questions, including, could multi-drug resistant Mannheimia haemolytica also be isolated from cattle that were not given metaphylaxis but were treated for BRD? Would cattle with multi-drug resistant Mannheimia haemolytica respond to treatment for BRD? Some cattle that receive metaphylaxis require antimicrobial treatment. If they're already multi-drug resistant to the Mannheimia haemolytica, would they respond to treatment? That was a question that we had. And would multi-drug resistant Mannheimia lead to worse health outcomes in cattle that were given metaphylaxis? And so we undertook this research study to evaluate some of these questions. We wanted to determine the effect of tulathromycin metaphylaxis on antimicrobial resistance in Mannheimia haemolytica as measured by the phenotype of Mannheimia isolated from the cattle by culture and sensitivity testing. We also wanted to look at the entire microbial population with 16S mitogenomic sequencing. And we also wanted to look at the resistome, which is the population of all antimicrobial resistance genes in the cattle by shotgun sequencing. And we also looked at health and production outcomes, including morbidity, mortality, and weight gain. So in 4 replicate trials, we enrolled 80 cattle. They were randomly assigned to receive metaphylaxis or not. And then over the next 21 days, the cattle were checked every day for signs of BRD. And if they required additional treatment for BRD, they were moved to another pasture. So at 21 days, in each of these trials, we had 4 different pasture groups that had received metaphylaxis and treatment, metaphylaxis but no treatment, no metaphylaxis but treatment, or no metaphylaxis and no treatment. These were Angus crossbred heifers weighing between 180 and 225 kilograms at arrival. These were out on grass, as is typical in Mississippi, and as I said, they were checked daily. At arrival, the cattle in the meta group received 2.5 mg per kg of sub-Q tulathromycin. All of the cattle were treated as you see there, dewormed with fenbendazole and doramectin, vaccinated with a modified live viral 5-way vaccine and a 7-way clostridial vaccine, ear-notched for BBDPI testing. We collected some blood for some other research projects, and we took a rectal temperature. All of the samples and all the data I'm going to describe to you come from nasopharyngeal swabs. These were collected by, first we clean the nostril with a single-use paper towel, and then we pass a double-guarded nasopharyngeal swab. We collected 2 swabs from each nostril, and the first swab from the right and the left nostril were paired for bacterial culture. The second swab from the right and the left nostril were used for DNA extraction. The extracted DNA from both nostrils were pooled, and then as I will show you, we went on to pool the DNA from cattle for the metagenomic sequencing and the resistome evaluation. We collected swabs at day 0, 14, and 70. For culture, we used pretty standard methodology. The swabs were placed in Amy's transport media. We cultured them on TSA agar with 5% sheep blood and did antimicrobial susceptibility testing using the Sensititer BO-P07 plate. For the DNA sequencing and analysis, we again pooled the DNA from the cattle in different groups. So when all the cattle were sampled, their individual swabs were put in the freezer. At the end of the study, we isolated the DNA, and then we identified the swabs from cattle, for example, that had received metaphylaxis and treatment, and we created pools. And there were 5 pools from those cattle at arrival and 5 pools from those cattle at week 3. And you can see that in the second column of the table. In the third column of the table, you can see that we had 12 pools from the cattle that received metaphylaxis but no treatment from their arrival samples, and 12 pools from their week 3 samples, and so on. In total, we had 39 pools of DNA from the cattle at arrival and 39 pools of DNA from the cattle at week 3. In the interest of time, I'm not going to show the sequencing and analysis methodology, but I'm happy to share that with you after the talk if you like. Cattle were defined as having BRD based on a clinical score ranging from 0 to 4. They were defined as a BRD case if they had a score of 1 or 2 and also a rectal temperature of at least 40 degrees centigrade. If they had a score of 3 or 4, they were considered a case regardless of treatment. Oh, sorry about that. That was too fast. So because the cattle in the meta group received a long-acting macrolide, they were not eligible for any treatment for BRD until day 8 of the study. Cattle in the no meta group were eligible on day 1. The first treatment was ceftiofur, and then the cattle were not eligible for treatment again until 7 days had passed. If after 7 days, cattle that received ceftiofur were again defined as a clinical case of BRD, they received fluorphenicol, and they were not eligible to be treated for another 4 days. If at that time they were again seen to have BRD, they were given a treatment with oxytetracycline long-acting. And so the results. And so first I'm going to show you the clinical data. The weight gain data in this table, you can see that the left-hand column represents the study group. We've got the data for each of the 4 trials, and then down in the bottom row, we have the data for all the trials added together. You can see that in the second column, the groups meta or no meta, and then all cattle are shown. And in the far right column, you can see the weight gain, the average daily gain in kilograms. And if we just focus on the bottom of the table here, you can see that the average daily gain was about 1 kilogram for the cattle in the meta group and about 0.7 kilogram for the cattle in the no meta group, and that was statistically significantly different. And so cattle that were given metaphylaxis at arrival gained more weight over the course, over the first 3 weeks of the study. And health, again, first column shows the trial, second the groups, third column shows you the number and percent of animals treated for any reason. So the third column of the table is the treatments for any reason that required antimicrobials. The fourth column you can see is the number and percent of animals treated for BRD, and you can see that most of the cattle, when they were treated, it was for BRD. The fifth column is the number and percent of cattle that required 2 or more treatments for BRD, and if you just scan your eye down that column, you see that the numbers were really very small. And the last column of the table shows the mortality, the cattle that died. And again, the numbers were really pretty small. And so if we just focus on the summary, we can see that the number and percent of animals treated for any reason was significantly smaller in the metagroup than in the no metagroup, and the number and percent of animals treated for BRD was smaller in the metagroup than in the no metagroup. We treated overall for BRD 28% of the cattle in the no metagroup versus 12% of the cattle in the metagroup. And this is the Mannheimia haemolytica isolation and the identification of multi-drug resistant Mannheimia at arrival and at 4 weeks. If you look at the left-hand side of the figure, the orange column shows you that in the metagroup, 39 of those cattle, we isolated Mannheimia, and of those 39 Mannheimia isolates, 8 of them were multi-drug resistant. In the no meta cattle, we isolated 33 Mannheimia isolates, and so that was out of 40, remember. No, this is for the whole study, sorry about that. So this would be total. And 9 of those were multi-drug resistant. So the left-hand side of the table, we expect the cattle to be the same at that point, and they are essentially the same because those are their arrival samples. And then if we look at the right-hand side of the table, we can see that at week 3, the cattle that received metaphylaxis but no further antimicrobials, we isolated 68 Mannheimia isolates, and 47 of those were multi-drug resistant. Again, multi-drug resistant means resistant to 3 or more classes of antimicrobials. In contrast, the cattle that received no meta, and so these are cattle that had no antimicrobials at all for the first 21 days of the study, we isolated Mannheimia from 45 of those cattle, but only 4 of those Mannheimia were multi-drug resistant. In the cattle that had received meta but also required an additional treatment for BRD, we isolated 9 Mannheimia, and all of those were multi-drug resistant. The cattle that did not receive metaphylaxis but then did require treatment for BRD, we isolated 17 Mannheimia, and 9 of those were multi-drug resistant. And so now we're going to look at the factors that were significant between the groups, or factors, I should clarify, that were significantly associated with different outcomes. So for average daily weight gain at 3 weeks, the group was significant, and cattle that did not receive meta gained significantly less weight. Also, there was a trial effect. Cattle in the fall of 2019 gained more weight than cattle in the other treatment or the other trials. For BRD treatment at 3 weeks, receiving metaphylaxis had an effect. Cattle that did not receive metaphylaxis, the odds were 3 times greater that they would be treated for BRD. Also, arrival weight had a significant effect on risk for treatment for BRD. Cattle that were lighter at arrival were more likely to be treated for BRD. Mortality at 3 weeks, there was not a statistically significant effect of treatment, but if the cattle in either group were treated for BRD, that was significantly associated with increased risk for death. So cattle that were not treated for BRD, their odds of death was 0.07 times that of cattle that were treated for BRD. Now, this is where the figures get a little complicated. In this slide, we're showing you the amplicon sequence variants. So this is basically the bacteria that we're identifying with metagenomic sequencing, and also the antimicrobial resistance genes, the richness and the diversity at arrival versus 3 weeks. And so if you look at the figure, focus first across the top. The top 2 graphs show the richness for the ASVs, that's all the bacteria, or the ARGs, that's the antimicrobial resistance genes. And if you look at the little superscripts, the star indicates different from baseline. The letters indicate different between groups. And if you look at the legend, the dark purple are the cattle that got meta and treatment. The light purple are cattle that got meta and no treatment. The right of the legend, you can see for the sort of pink, it's the cattle that did not get meta, but they were treated for BRD. And the light orange is cattle that didn't get treated and didn't get meta. So the dark purple are the cattle that got the most antibiotics. These are cattle that got meta and also got a subsequent treatment for BRD. The light orange are the cattle that got no antibiotics. I hope that helps. So if we look up at the top, we can see that between arrival on the left, focus first on the top left figure. At arrival and at week 3, there is no difference in the richness of the bacteria identified with metagenomic sequencing. But if we look at the right figure at the top, we can see that there was a difference in antimicrobial resistance genes. And if you focus on the asterisks, you can see that the cattle that received meta had significantly more richness of antimicrobial resistance genes compared to the cattle that didn't. If we look down at the bottom of the graph, we're looking at the diversity. On the left, focusing on the ASVs, again, that's the bacteria that we've identified metagenomically, and we can see that only the cattle that got no meta but were treated were different from baseline. There were some differences. Actually, the cattle that were treated for antimicrobials and didn't receive meta, forget about the left on the bottom, it's a little confusing. On the right on the bottom, you can see that the antimicrobial resistance genes are significantly more diverse in the cattle that got metaphylaxis, but also the cattle that didn't, although there were differences among the groups. Now, this is the community structure, and what I really want you to focus on is the right-hand side of the figure, where we can see the week 3 effects. And we can see in the bottom right-hand side that the resistome was different at week 3 in cattle that didn't receive any antimicrobials as compared to cattle that did receive antimicrobials, either meta and treatment or treatment only. And this is where I think I want to spend kind of much of the rest of the time that we have. Look at the relative abundance of the bacterial families in these cattle. Down at the bottom of these graphs, you can see the families that were the 5 most abundant. And the first 3 are the mycoplasmas, the moraxellas, and the pastorellas. And so these are the bacteria we think about a lot in respiratory disease. And if you look at arrival versus week 3 for the mycoplasmas, there was a great increase in abundance of mycoplasmas in all of the groups. And the groups that, the cattle that never got any antimicrobials had the lowest abundance of mycoplasma. In contrast, if you look at the moraxella at week 3, the cattle that never got antimicrobials had the highest prevalence of moraxella. And there's some other interesting differences, but in the interest of time, I'm going to keep going. The antimicrobial resistance gene resistome data ended up surprising us. If you look at the left, you see the results for abundance of antimicrobial resistance genes. First in the macrolide family, MLS, that's the macrolide lincosamide streptogramin family. And so remember, these cattle got a macrolide at arrival. That's what the metaphylaxis was. So we are quite interested in what's happening with the macrolide genes. But if you look at arrival versus week 3, actually the abundance of macrolide resistance genes went down. That was really the opposite of what we expected to see. In the cattle, if you look at the next class of antimicrobials, the tetracyclines, versus week 3 versus the arrival, you can see that the abundance of tetracycline resistance genes went up, but most in the orange group, and that's the group that never got any antimicrobials. And if we look among the groups at week 3, you know, we were expecting to see more abundance of macrolide resistance genes in the cattle that got the metaphylaxis, but that's not what we saw. If you look over at the aminoglycoside group, that's where we saw some differences among the groups, but we never administered aminoglycosides in this study. All right, so to summarize, cattle that received metaphylaxis had a significantly lower proportion were treated for BRD, but a significantly higher proportion had multi-drug resistant Mannheimia. And I didn't show you the 10-week data, but that difference in multi-drug resistance persisted even out to 10 weeks. Metaphylaxis was associated with increased richness and diversity of antimicrobial resistance genes, but not in genes related to antimicrobials that were given during the trial. And in fact, there was a decrease in macrolide antimicrobial resistance genes. The resistome results are a little bit difficult to explain, But remember that the resistome doesn't just represent the Mannheimia and the Pasteurella. It represents all the bacteria that we could get DNA from off those nasopharyngeal swabs. So I think we just have to remember that the resistome is representing the whole community and not just the AMR bacteria. Maybe other bacteria are much more prevalent at 3 weeks, and they dilute the number of macrolide AMR genes. And so we are doing an analysis of the Mannheimia specifically that's ongoing. We did see some increased resistance genes for aminoglycosides, but we didn't, again, use them in the study. So, but this might be due to naturally occurring AMR genes in other bacteria. So, in summary, really, macrolide metaphylaxis led to improved health while promoting increased prevalence of multi-drug resistance, and this was associated with genetic elements called ICE that have been shown to be transferred among bacteria. We didn't show that data today. This is an ethical dilemma. I mean, the cattle stayed healthier when they got metaphylaxis, but they had a higher proportion of multi-drug resistant bacteria. So next steps, possibly improve methods to give metaphylaxis only to the cattle that will benefit, maybe individual cattle or cattle cohorts, or find ways to induce protective health effects of metaphylaxis that don't generate AMR. And I want to acknowledge my grad student who wasn't able to attend the meeting, Dr. Will Crosby. He collected the swabs, he isolated the Mannheimia, he analyzed the data, and he did a whole lot more. And I want to acknowledge all of our collaborators from many different places, and I think it's going to be hard to go back. So a lot of people were involved, and I'm very grateful for the help. Thank you for your time.
Thank you. We have time, one question. Any questions? Thank you very much. Thank you everyone for attending this forum. Now we are going to have a break of 30 minutes, and the next presentation will start at 11 a.m. Thank you.
Perfect. Bueno, we are going to begin with the keynote, the last of this session, and I'm going to introduce to Dr. Richard Pereira, obtaining his veterinary degree in 2008 from the Federal University Uberlândia, Brazil. From 2008 to 2011, he completed 3 years of clinical training in food animals health and reproduction at the University of Florida and Cornell University. In 2015, he completed his PhD degree in Cornell University with a focus on epidemiology, genomics, and statistics. Since 2015, Dr. Pereira has been a faculty at the University of California, Davis, where he is an associate professor and a clinician in the livestock hair health and reproduction service. Dr. Pereira is board certified in the American College of Veterinary Preventive Medicine. His research interest is on dairy cattle, hair health, and reproduction using epidemiology, statistics, microbiology, and genomics as tools to generate novel knowledge that will increase animal welfare, productivity, reproduction, and health, and support a sustainable and safe food chain. Welcome, Dr. Pereira.
Thank you for the introduction, and thank you again for the organizing committee for the opportunity to be sharing some information today for some updates we have for Metritis and just kind of get everyone thinking about it a little bit. Okay. So this is just an outline of what I'm hoping to talk today. I know I'm a little bit ambitious, so I'll try to keep it moving, hopefully keep some time for questions, but I wanted to briefly just talk a little bit about Metritis as a whole, just the cost, some challenges that we've seen more in a foot on the ground at the farm, some ideas for preventing Metritis, nothing too novel, just some general ideas, and then go through some pathogen-focused concepts for colonization and virulence factors that could result in Metritis, talk a little bit about microbiota, and finalize with some new concepts of potential areas that we could be exploring. Okay. So one question is, why should you care? Why should the farmer care? Why should we even worry about Metritis? So this is some study I'm presenting from 2021, Dr. Silva lab, where they looked at the mean cost of Metritis, and if you go into the paper, you'll see there's a range, so there's different factors that could result in difference in that cost, but overall on mean cost is estimated about $500 per case. Some of the reasons include milk-yield, pregnancy rates, choline rates, and when you break it down into the nitty-picky, was the difference between cows with and without Metritis, you'll see that everything that you want for your cows is going to be affected. So drop in less milk, less profit, right? Dry matter intake is reduced. Pregnancy by 205 days is reduced. The only positive things are things that you don't want to have on your herd, right? Increased death, increased animals sold, cold, more treatment cost per cow, and increased replacement. So overall, I think this helped establish Metritis is a problem that's very costly to the farm. So now we established that, so what would be some things that we can do? What could I do to reduce Metritis in my herd? How could I approach that? And I think one important thing for any disease is being able to effectively and accurately diagnose it. And I'm always amazed how Metritis is one disease that we still have that issue. There's still a lot of challenges and inconsistencies on that. And this is some data presenting from 2018, study conducted in Dr. Silva Del Rio lab at UC Davis. And they collected data from 45 dairy farms in California. And looking at some farm practices, and I'm just presenting the ones focused on Metritis diagnosis. And here you can see that for most dairies, metritis is diagnosed using rectal palpation. And when you look at what did they use to make a treatment decision on the farm, first you'll see there's a lot of variation, with the most common being based on just vaginal discharge, with some variation with use or not of fever, and or fever alone, and so on. And overall, what you conclude is that you can definitely agree that there's a lot of inconsistencies, and there's a lot of opportunities maybe for veterinarians to be interacting with the farm workers and talking about accurate diagnosis of metritis. Unfortunately, when we go into academia and some papers, we still see that as an issue, and this is a study published by some work from my PhD that just finished her work last year, Dr. Adriana Garzon, where we did a scoping review looking at diagnosis of metritis and treatment. And for this study, we used the golden standard definition as here, the metritis as a vaginal discharge with a fetid, red-brown, watery discharge with or without a fever. And what we observed, and this is some tables from that we observed from the studies, is that many times there was missing information. When we look at diagnostic tool, many papers didn't reveal what did they use for diagnostic tool. Look at viscosity, many papers didn't define that. The color, there's a lot of different colors if you're trying to choose a color for your house there. But a lot of papers didn't report that, and a lot of inconsistency for odor. And I think that's important, because when we're trying to compare studies and make sure that the study that I'm looking here is properly defining a case definition for another study that I'm trying to compare results, that's really important, and those differences could affect outcome and accuracy of data. So just a thing for us in academia to be thinking more for consistency on that part. Looking at treatment of cows, and this is focused on dairies in the US and California. So I know that some of these drugs may not be approved in your country, but just take that in mind, more about how often are cows treated. And this is data from two studies. Again, that initial study from Dr. Silva de Rio lab, and a study from one of my PhD students from 2022. And what we found was the most common treatment was ceftriaxone for metritis, with some beta-lactams being used. And in California, we still have a lot of farms that use intrauterine infusion of animals with tetracycline too, so that is another common treatment. But overall, something we see very commonly is that basically any treatment, any animal that's diagnosed with metritis will receive a treatment. So moving on, so what can we do, right? What are our ideas or things that we could do to change and maybe improve? And I'm an epidemiologist in heart, so any chance I get to show the epidemiological triad, I will. And I think it's important for any disease, and metritis also. So I think about, okay, is the agent the problem? Is the host? Can we reduce the risk of infection in the host? Is it immunological? Is it nutritional? Is the environment? Is it stress? Is it heat stress? Is it hygiene? And so on. So those are just some concepts that always have in mind. And there's lots of studies trying to look at those and look at how much they affect the evolution of disease, right? This is always the concerns that we have. What are the factors we have for prepartum, and then once the animal calves, what are the potentials for retained placenta, metritis, and all the other developing reproductive diseases that could reduce reproductive efficiency and productive efficiency of that animal, right? So it's a big topic. So for the next slides, I'm really going to focus more on the pathogen. So what can we do for that? Is there a specific pathogen that we would be worried? Is the uterus sterile when the animal calves, and so on? So I'll start with this very interesting study that was published in 2017, where they tried to answer that question: is the healthy pregnant uterus a bacteriological sterile environment? So for this study, they used animals from slaughterhouse. They collected specimens from intercurricular endometrium and placentomes, and they run histology, fluorescent in situ hybridization, and 16S sequencing. What this study found was really surprising, because in these supposedly sterile pregnant animals, they observed bacteria present in more than 90% of those animals. And these included bacteria that we have associated with metritis and identified, such as Fusobacterium, Droparella, and Perfluoromonas. And that's just some cool images from their study identifying those pathogens in those histology samples. And what we have been seeing already is that we already had some suspicions of that, and this is just showing some of the results from the 16S for this study. Again, some bacteria that we see on this list are ones that we've associated with metritis before, but a lot of these are also observed in other studies where they find animals without metritis that have that bacteria and don't seem to be causing infection. So overall, what we concluded from this one is bacteria can be present in the uterus without causing inflammation or infection. So it can be present, including bacteria that we previously may have had concerns that could cause uterine infection. And this isn't an isolated study. There's a study that actually in the same year that looked at very similar approach. They looked at virgin heifers and also pregnant animals and found very similar results. And their hypothesis for the second study was that the microbiome may be dormant. And then once a cow calves in that postpartum period, there are changes that could allow some specific pathogens to thrive. So that goes back to, again, the triad, right? So the assumption that comes up from this is that the presence of bacteria alone is probably not enough to cause the infection. There are other factors, potentially from the host or from the environment, that could cause that. And so far, we haven't talked about virulent factors, so I thought that would be appropriate next area for us to think about. So could maybe, okay, this pathogen doesn't cause metritis, but not all pathogens are the same. Could there be specific virulence factors that result in metritis? So for the next slides, I'm going to talk a little bit about some research that we have in that area that has been evolving, and some findings that have been really changing over time as we use new technologies. This is a study from 2010 from Dr. Bicalio. One of the first studies really looking at virulence factors in E. coli. That is one pathogen that we're worried in metritis. And from this study specifically, they identified that they did see, using a PCR approach, that there were some virulence factors that they believe were associated with metritis, including FIMH. A following study in 2016, so 6 years later, using a different approach, a radioactive probe hybridization, doing a very similar study, E. coli from intrauterine, trying to look at virulence factors and associations. And from this study, they already identified some different findings. One was that the FIMH didn't seem to be associated for metritis, and that overall virulence factors were better predictors of animals that would not develop metritis than animals that would develop metritis. And this would be one study that I want to talk more about today from my PhD student, Adriana Garzon. And for this one, we dug a little bit deeper. We did a whole genome sequencing of intrauterine E. coli to really try to look at that information, try to compare resistance and virulence factors from E. coli. And also for this one, we did some comparative genomics, comparing E. coli from metritis, from E. coli from isolated from other diseases such as metritis, mastitis, diarrhea, and to compare to these other diseases. For this study, we used a total of 25 dairy farms. It was a cross-sectional. For each farm, we collected animals that fell in these three categories. Control, so animals without any sign of metritis, animals with a classical sign. And we added this in between because we see these animals that don't quite fit 100% the criteria for metritis. They still have this pus discharge, sometimes not fetid. So we created this category to try to see if we identified any differences. For this study, for this part, we use a total of 140 isolates. And this is one of the findings that I wanted to present. And what this is doing, it's a whole genome distance matrix that shows comparison of our E. coli from the metritis and from the metritis control against E. coli collected from different diseases such as diarrhea and mastitis. And this is comparing how associated they are. So if you see a cluster that we see all this cluster with mastitis, diarrhea, metritis, that means that they're genomically very similar. You can't distinguish E. coli that was from metritis from an E. coli you found in mastitis. What we found from this analysis is that overall metritis it clusters together with all these other diseases. It doesn't differentiate from metritis, E. coli from animals with or without metritis. And it was nice to see that the tool works, because we did see that there were some clusters for other diseases that would indicate specific E. coli for mastitis. We saw 2 clusters from that, and specific for diarrhea. But this kind of goes back to the idea we don't really have an E. coli that's specific for metritis that's really going to drive that. So there's other factors that probably play a role. And we did look at virulence factors again, and we did in a comparative manner, looking and comparing metritis with animals without metritis control there, mastitis, diarrhea. And similarly, we didn't find really a main virulence factor associated with metritis. We did find virulence factors for mastitis and diarrhea that were of relevance. And we didn't find, again, that FIMH that initially was suspected as a virulence factor. And if anything, we found that was present in almost all isolates. And it's more of an indicative of the presence of E. coli. So overall, what this indicates is E. coli doesn't seem to be, we don't seem to have a specific E. coli that would result in metritis. We don't have any specific virulence factor. Again, this doesn't mean that E. coli cannot cause metritis. It just means that we don't have one that we could call a specific endometrial or metritic E. coli. So there are other factors that have to be present to really allow infection to happen. And again, this is a very E. coli-centric research based on just the concept that E. coli is an important player with metritis. But what about the microbiome, right? We're in this new era. We sequence anything that we see. We're trying to understand. So what do we look at that? How do we compare the microbiome from animals with metritis and without metritis? So using the same samples we collected from that previous study, 25 dairy farms, and a cross-sectional study from those 3 groups. And this is a study that was conducted by a PhD, my student, or Carl Bazbaz. And we looked at using deep shotgun sequencing to assess the microbial ecology and diversity of animals with metritis, without metritis, and without pus discharge. For this approach, again, intrauterine swab samples collected, and from that, we extracted DNA and conducted deep shotgun sequencing. This is just initial data that I want to show that talks a little bit about diversity and richness. So here I'm displaying the Chow-1 index. That's an index for richness. It just means how many different types of bacteria you may find in an environment. And Shannon index, that's a diversity. It talks about how many are present, but also accounts for evenness. And it's a better measurement of what you could see in a normal situation. And what we saw from this was, as you expect for metritis cases, we had a lot more richness, so a lot more diversity, a lot more types of bacteria present in the uterus. But when we looked at diversity, control animals have a much better diversity compared with metritis or animals with pus discharge. And this is a classical dysbiosis situation that we see in disease, right? That's the idea that dysbiosis can increase the susceptibility of environment to invasion by pathogenic pathogens. So that's something that we did notice from this study. This is a newer display that one of our collaborators for this project did, and it's kind of cool the way that it works. And for here, just explain a little bit. Here we're comparing the microbiome of metritis in control animals. The purple here is are bacteria that we found on both groups. The green are pathogens, are bacteria that we've been associated with pathogens before and how correlated they are. And then we had some bacteria that are really exclusive for metritis and some that are exclusive metritis and exclusive for control animals. This is kind of the idea of a Venn diagram, but we're adding abundance values to this. So From this, we did identify specific bacteria that could be present more often in control animals without metritis and animals with metritis. And again, it shows there's an abundance of bacteria there. So there's potential, a lot of research that we can look in combination to see how these bacteria maybe together sustain the possibility for infection. So overall, what we found from this study, using the NCOM BC analysis, and this is an analysis of comparison that accounts for bias. That's something we're always worried with microbiome. We're looking at a lot of data. If you're not careful enough, bias, you can result in bias in your analysis. This analysis really helps control for that, and it did identify some of the big players that we found for metritis in these cases. And really what this tells us that we have to learn more. So we see these pathogens. We don't want to just isolate and work with one pathogen alone. We know there's potential for different pathogens working together that could result in infection. So that's something that we have in mind and where more research really should be conducted and try to see if there's a dynamic on that perspective. Okay, so we defined that yes, pathogens are probably playing a role, metritis is important, but what else can we do? Is there potential? Do we really have to treat all cases? Can potential spontaneous cure occur? And what we move from that? So I'm shifting a little bit the wheels here, and this is moving into the area of what's next? What can we do? What can we learn from some of our studies that have been conducted? So talking about spontaneous cure, and what we've learned so far, and this is presenting data from a few different studies that are out there. And this first one is about studies comparing spontaneous cure in animals with metritis. And this is a case where they have the studies that did identify animals with metritis and did not treat those animals and follow them through and saw if they did have spontaneous cure. And overall, from these studies, you can see that in all of these studies, they'd use an antibiotic, and they saw that for animals that were treated, spontaneous cure was from 75 to 78%. What's just kind of impressive is the non-treated animals that they had from 55 to 62% of animals that would cure without any treatment. Then the question that follows it, do we really have to treat? That's a pretty high cure percent, or is there any consequences from not treating? So this is a study done by Silva in 2021 that he really tried to answer that question. And he looked at non-selective treatment, meaning if they have metritis, we treat them independent of what else we see, compared to animals diagnosed with metritis without treatment. And for this study, there was identified that treating animals with antibiotic, and this study he did use ceftriaxone as well, did improve reproductive performance in production, and there was increased return to investment. So what this tells us is that there's a high percent of animals that could have spontaneous cure, but we can't just not treat an animal. There is advantage of treating animals with metritis, so there are some cases that could benefit from that treatment. So that would be, I'd say, the golden question, and it goes to other diseases that we've been working with and risk of diseases. Can we identify what animals would require or would not require treatment, or that would have a higher chance of spontaneous cure without detrimental impacts to reproduction and production? So that was the goal of this study that it was conducted by Dr. Eduardo and Dr. Fabio Lima's lab at UC Davis, and it looked at identifying cow and environmental factors associated with metritis cure using traditional statistics in machine learning. So this is just an outline of this study. They used 550 cows. That was from a previous study where they had that similar case where they had animals diagnosed with metritis that were treated, animals diagnosed with metritis that were not treated. This was their definition for cure, so it would be the absence of fetid, watery, brownish discharge 12 days after diagnosis. If after that 12-day interval it was still present, then that was defined as a non-cure. This is just a quick summary of some statistics. They used 22 environmental and cow level factors and use, again, traditional stats and some fun machine learning there that you can read all about in their paper. It's quite an entertaining approach there to read about. And this is just the conclusions from that. What they found is for the multivariate logistic regression was that cows developing metritis at 7+ days had an increased milk production with a rectal temperature of less than 39.4 degrees Celsius, had increased likelihood of cure with an accuracy of about 75%. And they also observed that cows developing metritis early on, especially that within the first 5 days, especially if they had a fever, drop in milk, they had a lower odds of spontaneous cure. So overall, this would indicate early metritis cases probably have a lower risk of spontaneous cure, so you should probably treat, and later on a higher probability of spontaneous cure. But again, this is at a 75% accuracy. The machine learning analysis had a slightly lower accuracy, but it was able to integrate some other components that are of interest, including calving disorders, season, month of metritis, that really helped increase the perception and the idea of different factors that could be affecting the spontaneous cure. So overall, again, this work demonstrated that there's a possibility to identify animals that may be at high risk of spontaneous cure, but there's still a lot of more information needed because we really want to be very accurate, right? We don't want to let any animal that we would not treat that could have a decreased production or have impacts to their health or welfare. Okay, so what do we do next, right? What should we be focusing on and what should we be thinking about? And I think it's that idea that I talked in the beginning. It's not one factor, there are multiple factors, and I think that's where probably the studies have to be going to. They have to be incorporating more ideas, adding the effect of the environment, adding ideas of animal immunology and different factors that really could affect the host ability to be resistant or resilient to disease. How can we improve the environment factors, the stress, and any factor that would affect the animal? And again, learning more about pathogens, and with a lot of the new tools that we have the ability to integrate that data and to analyze it in a manner that would increase our ability to more effectively identify animals that may or may not require treatment would be ideal, right? Going back to that study I just showed, increasing the accuracy to very high levels where we'd have very low % of animals that would not be treated and could result in more acute or severe disease is the ideal goal. So I say that's the area to be thinking about, and it goes back to we won't get away with just one treatment. It's really improving management at the farm and trying to think as the farm as a whole and the role of the veterinarian really in that process. Okay, thank you again for the opportunity and hopefully some time for questions.
Thank you, Dr. Pereira. We have time some question. If you want to do a question, please go to the microphone central. Questions? It's a good opportunity.
We don't see it really good, but we recognize people.
Hi, hello.
Oh, I think I see someone.
Thank you for a nice presentation. I have a short question about treating metritis. You explained the way of therapy, so we still have ceftiofur, which seems to be the best option because it's very effective. It has no withdrawal time, so farmers seek for this drug. But do we have any alternative medicament? Because it's a critical important antimicrobial, so I don't expect a positive answer, but maybe you have some comments on that. Is there any alternative except prophylactic measurements, of course?
Yeah, No, thank you for that question. I think it's very good, thinking about antimicrobial stewardship and thinking about reducing the use of critically important microbials. So I think part of it is knowing what treatment will be effective. I think some of the data for spontaneous cure begs to ask, like, would this cow have been okay if I did not treat her? But for the cases that do require treatment, the question is, what pathogen should we be focusing on, and what is the susceptibility? And we do have data on that does show some of that impacts from treatment. We do have, I had another study that we looked at antimicrobial susceptibility of E. coli, trying to see a different pathogen in different levels. And of course, that could vary from farm to farm. But I think the question is, can we use different microbials? It really is hard, because at the end of the day, like you mentioned, if you use a drug that has 0 milk withhold, 0 meat withhold, I also call it sometimes an insurance for the farm, that if someone messes up at the work, the farmer puts that cow in the wrong pen, she goes and gets milk, it's not going to be a risk for losing a whole tank of milk from residues. But I think there are potential options out there, but it's very difficult on response to treatment and economics to convince right now. There are potential options that could work that are extra label, and then I think that questions, depending on legislation of the country that you're in, would you be allowed to use that drug in that matter in an extra label way? So I think it's one area to continue to think about. It's an area that I think you brought the right words. It's really, if we prevent and we don't have to treat, then that's the best option. But right now, I think it's one area that we have to continue to think about. But it's challenging to change a model if it works, and if antimicrobial drug use, because of the importance, is the only factor. It makes it very difficult to change something at the farm level unless there's a really strong reason for them to do it, be it government or some other factors. Yeah.
Did you see any difference applying ceftiofur compared with penicillin, for example?
We did ceftiofur. When we look at the susceptibility, ceftiofur overall they are still very susceptible to ceftiofur E. coli from intrauterine. For penicillin, we actually saw some resistance, and it goes back to still some concern sometimes with E. coli and breakpoints in what we're using and how we're using that to define. But from that other study, we did find some potential options. But ceftiofur, even though you saw this most common drug use in metritis, it still seemed to be highly susceptible, the ones that we detected in uteri. Yeah.
Thank you.
Yep.
I have just a small question about what do you think about the use of local instillation with isobetadine?
Could you repeat that last part of local?
Instillation of the uterus, then use intrauterine.
Intrauterine?
Yes.
Okay. That's a good question. I could be here for another half an hour. No, I think the challenge for intrauterine right now, and maybe something came up in the last few years and I have missed it, is the lack of evidence of how effective it is. I'd say, like I said, tetracycline is the most commonly drug that they infuse. The only study that I'm aware of is from 2006, I think, and they use a very different administration route. I have a lot of concerns because one is trauma. When they're infusing these, sometimes they're using rods. They're early postpartum. Farms that infuse, and I do pregnancy checks and so on, sometimes I feel more adhesions in the uteri, and I'm like, are they infusing this intra-abdominally because they're just puncturing through the uterus? And what's happening is, in some cases, I see them treating cows, again, training of workers and talking with them that don't really need treatment. They're just passing over lochia, and they're actually potentially inhibiting the progression of the animal and causing more trauma. So my perspective so far, based on the evidence-based data, is that you should not do it. It's just there's much more to lose than to gain. It's something that many farms have been done for a very long time. It's really hard to change that perception and that mentality. So I know that as a challenge for the veterinarian, but overall, definitely systemic seems the best evidence-based, seems to be the best response, and I definitely would try to go away from intrauterine infusions for metritis treatment. Yeah.
Thank you for a very interesting and clear review. Along with this question, what about NSIDs? We had European data some years ago about ketoprofen, but what's your take-home message on the usefulness of NSAID in a context of metritis? And I mean, it's an open discussion. I mean, there is the cure rate, of course, and the reproductive performances, but also in terms of welfare, obviously.
Okay, and you said NSA?
Sorry, yes, NSIDs, ketoprofen, meloxicam.
Oh, anti-inflammatory. Not sure the anti-inflammatory. That's a good question about thinking about inflammation in the uteri and pain. I think there are some studies that have started to look at that, and we don't think too much. And that is that a welfare concern? Are the cows like? Is there a negative impact for behavior from that inflammation, and would they benefit from anti-inflammatories? I think that's definitely one area to consider. I think it goes into sometimes, should we treat this animal with anti-inflammatory or not? And I think in the US and many farms, they use ceftriaxone because there's no milk withhold. Once you put anti-inflammatory, you have a milk withhold. And unless you really show productive data, it's hard sometimes to convince the farmer. I think in some cases, some more severe cases that may be followed through, like trauma and so on, it would definitely be beneficial. And I know there's some research out there, but it's something I think always to consider and to think about, but in a practical way and really getting that in the farm and convincing the farmer, that would be more challenging. So I think those are the two perspectives of the ideal scenario and what could we fit in a commercial system, but yeah. Well, that's a good question, yeah.
We have time for two or three more questions. Okay. Take your time.
Okay, I tried to give a good...
Yeah, it's perfect. We have a lot
Una
of time.
pregunta en español.
En español, ¿está bien? Sí, voy. I may need your help if I can't figure it out.
En México estamos acostumbrados a usar prostaglandinas, benzoato de estradiol, oxitóxicos. ¿Realmente esto ayuda para tratar las retenciones de placenta o metritis?
Sí. Yeah, that's, I'll have to answer in English, sorry. But that's a very good... Okay, so the question is using some different hormones, so prostaglandin, estradiol, or some other hormonal therapies for treatment of some of the postpartum uterine diseases. I think that's a good question. Right now, there's some studies out there looking at the ecbolic agents and potential for, I think most of the ones I've seen are looking about retained placenta or early uterine infection and potential for helping with evacuation. I think most of the evidence study I've seen is that there's lower evidence in the cow that it would be effective. For oxytocin, the receptors at that point don't seem to make a big difference. For prostaglandins, the biological concept is good, but then when you actually apply it, it doesn't seem to have a big clinical effect. And then when you talk more about more advanced clinical, subclinical endometritis, there's some studies that say it may be effective, it may be not effective, and I think it goes back to more of the presence or not of a corpus luteum and the ability to inhibit the immune response in the uterus because of the presence of progesterone. But for early postpartum where progesterone usually not a problem unless you have a persistent cell or something like that, and it could help with that case. It may be, but I'd say more evidence to support that would be great if it's really effective, and the evidence so far available doesn't seem to be as effective, yeah. But it's a good question, yeah, for alternatives, yeah.
Okay, thank you very much.
Sure.
That's it. We have time for 2 short questions. Moving to the next point of the program.
I think we're good now.
Yeah, I thought, yeah, you're good now. Okay, thank you very much, Dr. Pereira, for the keynote. Have a good one. And now we start with our scientific conference, and the first speaker today is Modo Bruno. I think you will understand me, and you will speak about the relationship between thoracic ultrasonography findings and etiology of bovine respiratory disease in beef cattle during the first month after arrival. Take a look, but I say you.
Okay.
Okay, you have now, I tell you, 15 minutes.
Okay. Hello, everyone. I'm very glad to be here today to present you a study conducted as part of my PhD and focusing on a relationship between thoracic ultrasonography and the etiology of bovine respiratory diseases in young cattle at fattening farms. Bovine respiratory diseases encompass a broad spectrum of inflammatory and or infectious conditions affecting both upper and or lower respiratory tracts and typically requiring antibiotic treatment. These antibiotics target bacteria involved, yet it is known that some respiratory disease or stages of the diseases are solely viral. To achieve an etiological diagnosis, more and more laboratory tests are used, but they have some limitation as they take time to yield results. But sometimes an immediate treatment is needed, particularly in case of contagious diseases. And the issue of which animals to sample remains problematic in field situation. So having co-side diagnostic tools to help this sampling strategy could be highly valuable, and specifically could thoracic ultrasonography be used for this purpose, as we know that there are some promising results linking nasal carriage of Mycoplasmopsis bovis and consolidation on thoracic ultrasonography. Thus, our research question was, is there an association between BRD pathogens and consolidation on thoracic ultrasonography in young cattle and fattening farms? And we had two objectives. The first was to assess the relevance and feasibility of thoracic ultrasonography in these animals in field conditions, because in most of the studies, the animals included are often lighter and younger than our animals. And the second objective was to test the association between consolidations and the infection by a single or multiple pathogen. So we conducted a prospective study between January and June 2023 in 6 fattening farms in Western France. And we included 126 animals. They were intact bull calves, mainly of Charolais breed. Their average age was around 9 months old, and their average weight was around 320 kilograms. The vaccination protocol was the same within a farm, but could vary across farms, with the intramuscular vaccinations, again, respiratory pathogens being the most common. On day 0, when the animals arrived at the farms, we examined 3 pens of animals. They all underwent clinical examination involving rectal temperature measurement and visual inspection for BRD signs, for example, nasal or ocular discharge, depression, anorexia. And we also collected samples to assess the seroconversion for the targeted pathogens between day 0 and day 28. Additionally, 1/3 of the animals underwent thoracic ultrasonography and had 2 nasal swabs, 1 in each nostril, to search for the same pathogens by PCR. After day 0, we selected one pen, and each week, all animals underwent clinical examination and thoracic ultrasonography. And the sick animals with a rectal temperature equal to or greater than 39.7 and at least one BRD sign underwent 2 nasal swabs. Focusing on thoracic ultrasonography, as we know that respiratory diseases typically progress craniocaudally and from right to left, we decided under field condition to focus solely on the right side of the thorax and on the 2 accessible most cranial intercostal spaces in these animals, namely the 1st and 5th intercostal spaces. Each intercostal space was divided into 2 portions with the shoulder line serving as a divider. It resulted in 4 portions per animal. And for each portion, we recorded the consolidation with the maximal area. Each day, we counted the number of portions with a consolidation, ranging from 0 to 4, and the total area of consolidation. And for the months, the maximal values of these results were retained for one animal. As our goal was to ensure that animals infected were truly infected, we incorporated vaccination data in our definition of infection status because the vaccination could vary across farms. And in case of a positive PCR result or seroconversion for a specific pathogen, we checked if the animal had been vaccinated intranasally or intramuscularly. If it was the case, it was considered immune. If not, it was considered infected. And the animals having high antibody levels at day 0 were also considered immune. Our statistical analyses were done using RStudio with the individual animal as the experimental unit. And we use simple descriptive statistics to characterize an animal health status and exposure to pathogens and consolidations. Fisher's tests were employed to test the association between health status and consolidations, while logistic regression models were used to test the association between consolidation and the infection by a single or multiple pathogens. Interestingly, our models trying to test the association between consolidation and single pathogen infection all failed because of excessive collinearity. During the first months of fattening, 38.9% of animals were considered sick at least once, and 25.4% were treated based on farmer decisions. On day 0, 1.6% of animals had one consolidation, and it increased to 16.7% afterwards. Our data showed a significant association between consolidation, the number and the size of consolidation, and the likelihood of being sick or treated. Specifically, treated animals had more consolidation and larger consolidation than untreated animals, and the same trend was observed for sick animals. On day 0, 3 pathogens were particularly associated with high antibody levels: bovine respiratory syncytial virus, bovine parainfluenza virus type 3, and Mannheimia haemolytica. These are pathogens against which the animals potentially could have been vaccinated being calves, but we could not retrieve this information in our animals. At day 0, the 2 most frequent pathogens detected in nasal cavities were bovine coronavirus and Pasteurella multocida. And afterwards, the 2 most frequent pathogens infected animals were bovine coronavirus and Mycoplasmopsis bovis. In this table, we listed all combination of pathogens observed in our population. So the bacteria are represented horizontally and the viruses are represented vertically. It's quite a little difficult to read, but 30.2% of animals were not infected by any pathogen. The two most frequent pathogens detected alone were bovine coronavirus and Mycoplasmopsis bovis, and they also had the highest frequency of combinations with other pathogens. We grouped this combination of pathogens into 4 categories: no pathogen detected, bacteria detected alone, virus detected alone, and multiple pathogens detected. And we compared the likelihood of having consolidation between these 4 categories. 2 interesting results emerged. The first is that none of the animals infected with no pathogen had consolidations, and a fairly high proportion of animals having consolidation also were infected with multiple pathogens. In order to conduct statistical analysis, we excluded the animals from whom no pathogen had been detected, and we compared the likelihood of having consolidation while being infected by a single pathogen or multiple pathogens. And the animals that were infected with multiple pathogens had more consolidation than the animals infected with a single pathogen. The first significant and important result of this study is that thoracic ultrasonography of the right hemithorax is feasible in field condition in our animals, and it has diagnostic value as we had a significant association between consolidation and the likelihood of being sick or treated. The second important result is that animals being infected by multiple pathogens had more consolidation than animals infected with a single pathogen. And there are some limitations to consider. On day 0, we detected almost no consolidation on our animal, whereas in some previous study with younger calves after transportation, they found around 15% of animals having consolidation at day 0. And finally, a fairly high proportion, over 50% of our sick or treated animals had no consolidation. So we can assume that thoracic ultrasonography in animals of this side may be a later stage diagnostic tool that's in pre-weaned calves. To conclude, we would like to suggest some application in the field for thoracic ultrasonography of the right side in young cattle at fattening farms. First, it could help to take the decision to implement antibiotic treatment at individual or metaphylactic treatment. As if you see consolidation, the animal is probably infected with multiple pathogens, notably bacteria. And secondly, it could help to guide the sampling strategy. For example, if you want to detect primary pathogens, typically viruses, to implement a vaccination protocol in the farm, it would be advisable to avoid sampling animals already exhibiting consolidations. Conversely, if you want to detect secondary pathogens to adapt antibiotic treatment, for example, you probably have to sample the animals with consolidations. I would like to thank my supervisors and the farmers and the students that helped me collect the data on the field. And I will be happy to I thank you for your attention, and I will be happy to take any questions you have if you speak slowly.
Yeah. The speak is open for questions. Okay.
Hello. Thank you for very interesting results. I just want to elaborate one of your conclusions that you don't recommend using animals based on consolidations when you want to target the primary pathogen. But what is the recommendation then? Which kind of animals should we sample in order to detect the primary pathogen?
Thank you. It's a very interesting question. It's maybe a little early in the study to have some strong recommendation, but to target primary agents with the results of this study, I would recommend to sample animals having hyperthermia, for example, but no consolidation on thoracic ultrasonography. Because with the fourth and fifth intercostal spaces, we scan the caudal part of cranial lung, so it's a little late in the disease progression, I think.
Elaborated, there are like only few studies, longitudinal studies, which actually show that the clinical signs appear even later than the consolidations. So that's what, like my concern, that how should we really target the animals for the primary pathogen detection?
But, sorry. But in these studies, they were on young cattle at fattening farms. It means animals with the same weight that my animals, that our animals, or it was on pre-weaned calves?
Actually, yeah, it kind of doesn't matter, but those studies which show that clinical signs appear a bit later are done on dairy cows, yeah.
Yes, I think that it's not a recommendation for pre-weaned calves, because in pre-weaned calves we know that the consolidation are more sensitive than clinical signs, but in our specific animals with their size, the consolidations that we can see on thoracic ultrasonography, it's not the same that consolidation that we could see on necropsy, for example, but they are probably a later stage diagnosis, and most of the studies on animals of this size conclude to a more interesting prognosis value than diagnosis value for thoracic ultrasonography.
Well, thank you for your interesting presentation. Maybe I was a bit slow, but you were faster. But did I understand well that the Jurgen at the Belgian group, they actually promote the TUS for predicting clinical stage? So they say you can detect the subclinical cases before they get clinical, and you say the other way around. You say if you find consolidations, you're actually too late. Then it's that's the stage of multi-pathogen infections.
Yeah, can you repeat, please?
Well, that they say you find subclinical infections with TUS, and you can predict there's going to be an episode of BRD when consolidations increase. While you say when you find consolidations, don't test these animals, then they are in a later stage.
Yes, this is the principal difference with pre-weaned cows, where the thoracic ultrasonography can be used to predict the clinical sign apparition. But in our animals, I think that the consolidations appears after clinical signs and in a later stage of the disease.
Okay, so I understood well. Thank you.
No questions anymore? Oh, the last
I
one.
do have a quick question. Thank you for that talk. Would you explain, maybe you said it and I missed it, would you explain why you decided to scan only the right side and not the left side?
Yes, it's because we were in field situation with a duration of manipulation that was already quite huge, and we decided to focus only on the right side because we know that with studies on necropsy, the respiratory diseases begin in this side of the lung. So to reduce the duration of the animals' manipulation, we decided to focus solely on the right side.
Okay, thank you very much. Thank you, Marie. We move to our second speaker today. That is Michael Bolton from the US, and speaking about the assessment of vaccine interference observed following co-administration of two modified live viral intranasal vaccines to Colostrum-Fed neonatal calves in the face of iberate chains. Michael, come to us. Green, can you move forward and come back. You have 20 minutes, take a look to the clock.
Okay.
And
Thank
after
you.
15 minutes, you have
Okay. All right, first of all, thank you very much for the invitation to the Congress to present this trial. I do have a little bad news for the group. I am not Michael Bolton. Michael actually arrived at the Congress and was over celebrating at Cochabongo and was detained by the Mexican authorities, and we're hoping to have him out by the time the final closing dinner opens. So, my name's Scott Nordstrom. I'm actually the Director of Strategic Development and Innovation at Merck Animal Health, and I am the second author on this paper, which just received publication in the American Journal of Veterinary Research. So this is the first publication that I'm aware of that considers the impact of administering two commercially available intranasal vaccines, and it examines their respective immune response, and then we also do a selective disease challenge. As many of you are aware, there's been an increase in the number of commercially available intranasal vaccines, and also an increase in the need for them with the neonates as we congregate more livestock. And we need to know the safety and efficacy of these vaccines when they're concurrently administered. This particular study considers the co-administration of a three-way modified live IBR, PI3, and BRSV, which we'll refer to as N3, and a bovine coronavirus vaccine. So our concern when we entered into this trial was these antigens are going into a lot of shared real estate in the mucosal surfaces, and we weren't sure who was going to win that battle. We know from previous work that we've done with this particular IBR and PI3 that we create a significant and consistent interferon response in the upper respiratory tract, which can increase the expression of antiviral genes. And this particular vaccine has been used a lot in the face of outbreaks with unknown causative agents and been very successful, I think, for that reason. BCV can be inhibited by interferon. BCV has developed mechanisms to inhibit interferon production and also signaling. And we don't know to the extent which BCV actually replicates in the gut as opposed to the upper respiratory tracts. And these factors could obviously affect the production of IgA and local and systemic IgG, as well as cell-mediated factors. So why the increase in oral vaccines for the neonates? Well, I think the obvious one is that it does offer us a beef quality assurance opportunity by not putting another needle in these calves. And when I began my career 30 years ago, when we had vaccine protocols where these calves would receive a dozen vaccines before we took them out of their housing, they became quite weary of the people that were entering those housing facilities. They can be used to inactivate or activate the innate immune response. And probably the most important reason we're using them is to overcome maternal antibodies. And this has specifically been demonstrated by work that we've done around BRSV and also corona. And then I think there's also an efficacy and safety opportunity. We use it to mitigate the endotoxin risk on some of the avirulent live bacterial vaccines that we have on the market. Okay, the goal or objective of this study was to compare the immune response of two commercially available modified live vaccines, and that would be the three-way N3 product and the bovine corona. Each was given intranasally alone or co-administered to young colostrum-fed calves. The second objective was to evaluate the interference and prevention of infection or disease following a BHV1 or IBR challenge when the same vaccines were co-administered or given alone. We utilized calves that were colostrum-fed because that's where our producers had been utilizing the vaccine. And the vaccines, when co-administered, were administered into separate nostrils. There were 36 male colostrum-fed calves, Holsteins, and they were gathered from a commercial dairy. All of them were BVD PI negative, and at about 10 days of age, all were vaccinated IN with either a diluent, the N3 vaccine, the BCV vaccine, or both vaccines administered in separate nostrils. The calves were housed separately for the study duration with no contact between the groups. The calves were revaccinated 4 weeks later. Nasal secretion and blood were collected prior to enrollment and weekly during the study period. 3 weeks after booster vaccines were given, the calves were challenged with a IBR and euthanized 10 days post-challenge to quantify the damage to the lung and monitor the pathology that occurred. All calves were seropositive to BHV1 and BCV prior to the vaccination due to the colostral antibodies they'd received at birth. No significant differences were observed when we compared the BCV-specific serum IgA and nasal IG, or serum IgG and nasal IgA antibody response in the BCV versus the BCV plus Nasalgen 3 groups, nor were there any significant differences when we compared the BHV1 serum-specific IgG and nasal IgA antibody responses in the Nasalgen 3 versus the BCV plus N3 group. The cytokine responses between the groups were also not significantly altered. When we looked at the results, the nasal BHV1 shedding after a BHV1 challenge was significantly reduced in both the N3 and the BCV plus N3 groups. There was significant reduction in lung pathology as observed when the BCV and N3 group was compared to the placebo and the BCV group. The BCV and N3 group had lower lung lesion scores than the N3 group alone and significantly lower lung lesion scores than controls after the BHV1 challenge. Another interesting finding was BCV alone numerically reduced the lung lesions compared to the diluent or control group after the BHV1 challenge. The study provided evidence that these two IN vaccines, N3 and BCV, can be co-administered to the neonate without a significant decrease in immunogenicity or a reduction in the prevention of BHV1 respiratory infection and disease. Also of interest, BCV vaccine alone had a protective effect against the lung pathology after the BHV1 challenge. This result highlights the role that coronavirus may play in total lung pathology, even with the inciting even if the inciting pathogen is not corona. So the study provided us with evidence of protective effect of bovis corona vaccine against lower respiratory disease in the face of a BHV1 challenge. The take-home message, the combination of BCV and N3 administered IN was safe in very young Holstein calves. The combination of BCV and N3 had similar immunogenicity profiles as N3 alone. The combination was effective as N3 alone against the IBR challenge, and this protection occurred in the face of maternal antibodies. And BCV alone had a protective effect when we were assessing lung lesion scores compared to control in the face of an unrelated IBR challenge. And I'm happy to field any questions you may have. All right. Perfect. Thank you.
No question? Thank you very much. Thanks. We come back to the program and now to Mexico. Alma, perfect. I will speak today about BRD endemicity, understanding the prevalence in Mexican herds, and taking the BRD. Mira, aquí tienes el agua.
¿Dónde?
Aquí tienes el agua.
Gracias.
Aquí tienen 20 minutos.
Ajá.
Tienes tiempo, porque este señor ha tardado menos.
Sí, yo
Ten
también.
tranquilamente y luego, mira, lo ves, 20 minutos empieza ahora y esto es el
¿Avanzar?
avanzar y esto para atrasar. No tenemos pointer.
Ok.
Habla tranquila.
Sí.
¿Te abro el agua?
Sí, por favor.
Y esto, tranquilita, tenemos tiempo. Gracias.
Thank you. Good afternoon. Ay. ¿Para regresar? Yo no le estoy haciendo nada. Pero uno. Sí. Good afternoon. Excuse me. We will address the endemicity of BBD and understand its prevalence in Mexican herds. The pathogenesis of bovine viral diarrhea is a complex disease. Pestivirus have 11 species, 25 subgenotypes, and cytopathic and non-cytopathic biotypes that infect domestic and wild ruminants. In addition, they show various types of transmission and different types of presentations, from subclinical, clinical, and transplacental infection that produce viral persistence due to immunotolerance. It's a disease without significant negative effects, causing economic losses that had been estimated at $80 million per year due to breeding cost, infertility, embryonic, and general mortality. In addition, it affects animal health and welfare. In America, the prevalence is 20 to 96%. In European countries without routine screening, It ranges between 18 to 80%. In Asia, prevalence has been reported as high as 65%. Mexico has a cattle population of more than 36 million heads, with 19-30% are calf-producing herds, an industry that with 5 other Latin American countries contributes with 50% of the world's of meat exports. Previous studies in Mexico have reported prevalence ranging from 31 to 98%. However, they had been limited in their scope. Therefore, our objective was to determine the national zero prevalence of BVD in Mexico and its association with risk factors. They may influence its distribution in cattle populations. To carry out this seroepidemiological study, a sample of over 2,600 bovine sera from healthy unvaccinated grazing cows was used. That covered 430 municipalities in 30 Mexican states. The country was divided in 5 regions: North, Gulf, Center, Peninsula, and Pacific, according to their geographic proximity, agroecological conditions, and similar management practices. Samples were diagnosed for seropositivity to the recombinant E2 protein of the BVD virus using a Luminex immunoassay previously standardized and validated by our laboratory with 100% sensitivity and 94% specificity. We found prevalence between 44 and 48%, classifying the level of the endemicity as mesoendemic to hyperendemic. No significant differences were found between regions. However, we observed high variability between municipalities. Each dot in the map represents a municipality, and the size of the dot reflects the magnitude of the prevalence for the municipality. It gave us the impression of the higher prevalences in coastal areas. Therefore, a logistic regression was used to estimate the prevalence and the relative risk for the environmental factors such as temperature, humidity, and climate, as well as production purpose, age of the animals, type of mating, breeding seasonality, and type of grazing. We found difference in humidity, type of mating, and breeding seasonality. Significant effects were found for environment with higher humidity, and the relative risk of seropositivity increased 50% compared to the national average, while in arid or very arid regions, the risk is reduced by 44%. The effect of the humidity on the resilience of the virus is complex and depends on factors such as structure of the virus and temperature, as well as the composition and volume of droplets and aerosols, which are related to the ratio of the evaporation. Factors that interact with each other, affecting viral stability. It's therefore difficult to establish a general conclusion about the resistance of enveloped viruses to high or low humidity. Some authors mentioned, however, that under conditions of high relative humidity in vitro, like 40%, The enveloped viruses, such as influenza and SARS-CoV-2, can remain infected for longer in aerosols. Similarly, when we evaluated the seasonality of breeding, continuous breeding showed higher prevalence and higher relative risk when compared to seasonally breeding, although it's hard to determine the reason for the result. It could be due to inspection behavior variable that may favor disease transmission. Regarding the type of service, we observed a higher prevalence and relative risk when animals were artificially inseminated, that in herds where natural mating occurred, probably reflects the spread use of the semen from the non-tested bulls or non-hygienic practices at insemination. In conclusion, we established that the national BVD prevalence is at mesoendemic to hyperendemic levels. The high environmental humidity associated with a higher seropositivity. And we found an increased seropositivity risk with year-round breeding and artificial insemination. Thank you. Any question?
Buen día. ¿Se puede hacer en castellano? ¿Lo traduce?
Gracias.
Buenísimo, más fácil.
Gracias.
Me gustó mucho la charla. Nosotros hacemos algo parecido en Argentina. Tengo dos preguntas, a ver si encontraron lo mismo. Nosotros vemos mucha relación entre la edad y la seroprevalencia, entonces quería saber de qué edad eran. Y la segunda cosa que vemos nosotros es que las granjas tienen o menos del 20% de animales prevalentes, o sea, son casi negativas, o más del 60%. Encontramos pocas granjas en el medio. ¿Ustedes ven lo mismo?
Bueno, ¿cómo?
The question from the colleague from Argentina. Argentina was the correlation between age and sero results. The first question. The second one was, do we find different types of results and prevalence? Less than 20, a lot of farms, and over 40. And what's
over 60?
Over 60.
No,
Sorry on that.
30 or 40,
Nothing,
like this farm, no.
Nothing in the middle. What's your experience, opinion?
Bueno, con relación a la edad, nuestros animales eran de 2 años, superiores a 2 años de edad, y no encontramos diferencias con respecto a la edad. Sí lo analizamos, pero no encontramos. Y en cuanto a las prevalencias que encontramos, la mayoría justamente andan entre el 50 y tantos al 60 y tantos %, y desgraciadamente en nuestro país no encontramos prevalencias tan bajas en las respiratorias, salvo leucosis, que en ciertas áreas sí encontramos prevalencias por ahí del 13%.
Muchas gracias.
Gracias.
The animals were 2 years old and did not see any correlation between seroconversion or sero results and age. And the question was, what about the seroconversion? And we found more or less 60% of the prevalence, and this is a high level. In Mexico, they find only low level, taking a look to leucosis with 30%.
Buenos días. Quería preguntar, ¿el diagnóstico es de genotipo 1 o genotipo 1 y 2?
Fue general, no podemos distinguir con porque es por serología. Estamos en desarrollo justamente de la prueba para detección de antígeno, para detectar el tipo 1 y tipo 2. Se conoce que en México creo que la más predominante es el tipo 2.
Y la otra pregunta es, ¿por qué no testearon los pequeños siendo un valor predictivo de la presencia de PIs? Le encontrar en las poblaciones de estetas anticuerpos que podía significar una exposición postcalostral. Es decir, después de la disminución postcalostral, que les podría insinuar, porque aparentemente es una endemicidad, y debía uno demostrar es que sí están los anticuerpos, pero que hay dinámica de la enfermedad que se está moviendo.
Claro, y justamente hacia allá vamos, en el siguiente paso, es nuestro siguiente paso, es detectar justamente a los persistentemente infectados. Sí.
Bueno, gracias.
Gracias.
The question was what kind of genotype, we identified, and we don't have any differentiation, probably type 2. And the second question was why not use animals younger than 2 years, and they're working now for chronicity and persistence, and less about this kind of age range. Any question anymore? Spanish, English? You get it?
Muchas gracias. Muchísimas gracias. Un aplauso, Alma. Y seguimos en México. Fernando. Ven. Fernando will speak about the lamb for the diagnostic of bovine diarrhea virus. You have 20 minutes. Go ahead. Mira, ahí se te va a poner a 20. Espera, todavía no. Tienes un montón de tiempo.
Sí, claro.
Y le das, mira, no tenemos la ISA. En el verdecito, avanzas. No. Están fuertes. No refleja. No refleja. Entonces, tienes 20 minutos. Ahora despacio, este es para atrás, pero tú, la vida para adelante. Le das al verde. Te abro el agua.
Gracias. Hi, thank you for staying here. Now we're going to talk about the Loop-Mediated Isothermal Amplification lamp for the diagnosis of bovine diarrhea virus. We are working at the INIFAP, and this is our team that's working on that. So bovine diarrhea virus is one of the most important pathogens in the complex respiratory disease, and many economic losses in the cattle and the versus of this disease. No, so this is important because are many phases of the disease. So this affects both reproduction and productivity in herds. This disease can result with the reduce of milk, early cooling, and increased mortality among young stock, poor reproductive performance, many disperse of this virus with an identification of these animals, mortality of young animals. So for the diagnosis of this disease, we have many tests to diagnose this infection. So we took for this disease, we have the antibody test for bulk milk, or antigen the detection for bulk for bulk milk, or individual for the detection of antigen by many type of diagnosis. And the most important are RT-PCR. That is one of the gold standard to make this found of the disease. So the objective of this work is due the importance and the impact of this disease. There is a need for diagnostic methods for rapid identification that could help eliminate of carriers in herds. The new diagnostic tools, such the Loop-Mediated Isothermal Amplification lab, we are working on the develop of one type of this lamp that is colorimetric and working with phenol red to make the diagnosis of this disease. So the methods of this work is for the first is the primer design, then the DNA extraction from samples and controls that we are working with one vaccine as a control, as a positive control. Then we took a PCR, a validate PCR that we are still working many years before. And then we test the samples and the control to standardize the lamp for this infection. So when we take the time, the concentration, the many different variants of the technique, so we can determine the time and the concentrations and volume for making this technique. So then we put the samples of nasals and vaginal swabs for making the technique, and then making a little statistic analysis. So for the first, we took the vaccine against the complex respiratory disease to make an extraction for the DNA, or RNA and DNA for herpes, for IBR and DBD. Then for making the primers, we are working with these software programs or bioinformatic programs that are NevLamp Primer Design Tool, Genius for making the alignments, and SnapGene for making for see or for view all the primers alignment with the reference gene bank and section that is that number. And we are making the primers for the gen E2 that codificate the protein E2. Then when we took the RNA from the vaccine, we make it the variations of concentration and time, that making a standard curve to make to see the amplification in a electrophoresis agar. So we can see that is not more important that they can that they have many or more DNA, and with more or less DNA concentration is the same result. So we have the first amplifications at an hour. So if you can see, when we have 25 nanograms and 1 hour is the first that change color in the reaction, and then that the next photo. So for the samples of nasal and vaginal swabs, we are making the PCR, and if you see, the nasal swabs are nothing of amplification for the samples, and in the vaginal swabs, sorry, we can see 3 amplifications. So when we took these the same samples for the vaginal swabs, this is in Spanish, sorry. For the previous reaction, we can see that all the samples are with the phenol red, and when we put 65 degrees standard with 1 hour, the samples are changing of color. So for the to prove that is correct amplification, we take it to agar electrophoresis for see the amplifications. And if you can see, the negative control is empty, the positive is making some, no sé cómo se dice, how do you say, ¿cómo se dice en español? Se me fue en español. Las bandas de amplificación, amplification bands. Sorry. In the positive control, we can see the amplification bands that are defined because this technique have the specificity that with three pairs of primers, we can took 8 different positions in the DNA target. So this is for the vaginal swabs. So if you can see before, for the vaginal swabs, only we have 3, but when we put in the lamp amplification, we have all the samples that are positive. We took these samples because early the cows have ¿cómo se dice? Let me think. The cows have reports before of the taking the samples, have reports for abortions. So we suspect that all the cows in this herd have the virus of the infection. So we can see that all the samples in the vaginal swabs are positive. But in the case of the nasal swabs, this is the image of the left. It's before the reaction, and if you see when we put to run the technique, only the sample number 6 are negative, and when you see the controls are the same as before. You can see. So this is because 5 of these cows that we took the samples of these have reproductive problems 2 weeks before the taking of these samples. So for the results, the LAMP technique detected 19 samples and 1 negative, of which 3 considered with the RT-PCR. However, the LAMP detected more positives than the regular PCR, using the samples as true negative in both techniques. To know specificity and sensitivity are 94 and 100% respectively. We know that we have to make more samples to check this sensitivity and specificity. We are working in that to making this or correct these numbers. Our team is working for develop of this technique for 9 different pathogens. We are working with all the viruses are implicated in the complex respiratory disease, that we are working with coronavirus, parainfluenza, syncytial, IBR, and DVD. And for Mycoplasma, Mycoplasma bovis, Pasteurella multocida, and Mannheimia haemolytica. So we took many samples, around 200 samples to correct these numbers, but we are in working on that. So the technique for DVD are still working with the same results with the new samples. And the conclusion is that LAMP has shown to be a quick alternative for the regular PCR, indicating that it's a relative test to be used in the countryside. Sensitivity and specificity also show solid results in the comparison with the RT-PCR, and LAMP is an option in laboratories that will not equip it, and we are still working on that for the development of these techniques for many diseases. So the acknowledgement is for the producers who allow the collection of the samples, and the financial sources for the project development and validation isothermal techniques for rapid molecular detection of the main disease of cattle. Sorry, my English is so poor, but I try to do my best.
Any questions?
It's me again. Very nice presentation. I have a couple of questions. Now you can rest, my Spanish guy. How do you treat the sample before running the test?
A nasal swab with the cultive medium.
Yes.
And fetal serum bovine that we prove, that we test before that is negative of bovine diarrhea virus.
But you don't use an extraction kit, just the sample. So you heat it, you put it. How do
you No. We make the extraction with many different kits and home extraction. And we have the same results.
And the prices, when you compare it with the screening test in the field, like the immunochromatography?
We try to put the prices low and are more or less the same with the technique of immunochromatography. You are in Argentina, but in Mexico it's around around $15, $18.
Okay, more or less the same there. So that's the price more or less. But you have to add the extraction kit, or
no? Yeah, with all the complete. Yeah.
Perfect. Thank you.
Thank you for the presentation. I'd like to know, so this LAMP system can detect which type of BVD, BVD 1, 2, 3, or how about the subtypes?
We are making the primers for the detection of the two types, DVD1 and DVD2, and we have the amplification and the sequencing of these amplifications to see that the two types are detecting in this technique. So we don't have can take the difference between 1 and 2. It's for both. The two, one and two, can the detection with the technique. Yeah. Yeah.
I'm sorry. So I'd like to confirm that BVD1 has many kinds of subtypes, and so this system can all of the subtypes of 1A. Is it correct?
We have the sequencing of so before of this work, we have the opportunity to isolate it, one virus with a persistent infectious, and then when we make the sequencing of these, are the bovine diarrhea 1, and we have many samples of ATCC samples that have the subtypes or the two of the genotype 2, and it's the same results for both genotypes. Sorry about my poor English.
So we come now to the last speaker today in this session. I'm Katrin Berg, speaking about prevalence, biosecurity, and risk management of bovine coronavirus infections in white and rose wild and dairy source calf farms in Europe. Coming back to Europe, please.
Yes.
20 minutes now, really now. We don't have pointers around that.
Okay.
We have only green to move away.
Okay.
I'm coming back with this one.
Yeah, thank you.
I'm going to give you water.
Thank you all for still being here right before lunch. At least you're not in a food coma. I will go back to bovine coronavirus. I think we've heard some really interesting talks about bovine coronavirus this morning, about their high prevalence in beef calves in France, about the possibility of a nasal vaccine, which is already on the market in Europe. And I now want to talk about a prevalence study that has been initiated and funded by MSD Animal Health, looking at how much bovine coronavirus do we have in what I call dairy source calves that are destined for, So dairy source calves that are destined for meat, so it could be white veal, roast veal, or simply calves that are raised to a higher age, and I call those dairy source beef. They're coming from the dairies. So I don't think I need to go into a lengthy discussion, explanation of bovine coronavirus. Of course, we are now much more aware of its presence, not only in enteric disease in calves or winter dysentery that even could happen in the summers, but it's also in the bovine respiratory disease complex. It has been shown here today that it definitely has an impact on the respiratory health. We know since the 1970s, 1980s already then we knew about its implications in neonatal diarrhea. Now it's becoming much more evident that it's a bigger player in the respiratory disease complex. So I think that we need those LAMP analyses there we had in the previous talk. Also, you need to do those for bovine coronavirus also. When we're looking at studies regarding bovine coronavirus presence, well, it's been described a bit everywhere ever since we started looking at it. It emerged and was first seen in the United States, and they did various studies in the United States here. You see the colors here, where the yellow is that we're doing antibody studies, and then the blue colors on the maps, there have been studies where they were looking for it in respiratory disease samples, and then the red samples are when they're looking at the enteric disease sample. So as you can see, it was first identified in America, then in Asia, then in Europe, then in Australia, so and in Africa. So pretty much everywhere. However, we tried to see how much do we have in Europe. You see that there's been scattered studies mostly looking at antibody levels in Europe. We really didn't know how prevalent is it and how much is it, how prevalent it is on farms. So we started doing a large study looking at what's the prevalence in dairy farms. And this study has now been finished, and I'm hoping to submit it within 2 months from now, looking at the prevalence in the young stock on dairy farms. And here we've been sampling farms all over Europe, as you can see, over 130 farms, but 120 farms are used with complete data. And what we found is in 80% of all of these farms, we found coronavirus in fecal and nasal swabs from calves. And I was actually very surprised. In these small swabs and with the sensitivity of the testing and everything, we found it in 24% of neonatal calves. 1 in 4. And 22% of the weaned calves. We were also sampling the fresh cows, and there again we found it there. So this, I think, was more than we had really expected. But what we also noticed in this study here, we found a continued shedding of the virus in these young calves. In all of the calves we're sampling up to 6 months of age. It wasn't just like the first month of life diarrhea and then a bit in the respiratory. It was continual shedding of the virus in these calves. We've also been doing a lot of risk analysis on these. Are there some factors that can implicate whether you have it or not? And unfortunately, biosecurity is not very good on dairy farms in general in Europe, nowhere in the whole world. Biosecurity in ruminant production is kind of a joke compared to what's being done in poultry and pigs and so on. So we're really good at spreading it around. And as you heard earlier this morning, we veterinarians with our stethoscopes are obviously the ones that are really trying to use that as some kind of work insurance, spreading viruses around. What we did notice was, of course, in this study, for example, was, yes, we did have reduced shedding of virus in the neonatal calves if they were vaccinated their dry cows against coronavirus. However, we also noticed that the calves after weaning, where we're starting to see the coronavirus being more involved in the respiratory disease, there we had really no protection of the dam vaccination. Now, fortunately enough, of course, we have this nasal vaccine available in Europe that can help out the herds. So that was a bit about the dairy study we're doing. And you can see the colors here in red, in the colors on this map here. You see the colors in really red. Those are the dairies where it's highly prevalent. And then you have a few dairy farms where there's less than 10%. Those are like in green. So as you can see, widespread throughout Europe, whether you're up in Sweden or down in Greece or in Portugal, we have similar pictures. So the goal of this study then was, again, now to look at the dairy source veal calves here and characterize, again, looking at what are there some risk factors here and biosecurity factors that are linked to the coronavirus in these dairy source calves. And we were then looking at the calves when they were arriving and then calves after they've been on the farm for at least 8 weeks if they're white veal because they're not weaned, or we were looking after weaning if they were roast veal or dairy source beef. Again, this was designed similar to our dairy study. We did a convenience enrollment of 5 to 10 farms per country, depending on type of production they have in the country. And as you may know, in Europe, in some countries we have an extensive white veal production, and in other countries it's all dairy source beef, where you slaughter the calves at around 15 months of age. In other ones, there's like roast veal, you slaughter them maybe at 8 months of age. It varies. And here again, we were going to look at the risk factors. So we had extensive questionnaires with all about 130 questions. We're looking at from where do the calves are coming and how they keeping the calves in general. Are they group housing the calves? Are they housing the calves in separate cubicles? What are they feeding? Nutrition. And then, of course, the biosecurity. We were using the BioCheck by the University of Ghent, which is kind of a scoring tool for biosecurity to see if there were some levels of biosecurity measures can be used. And then, of course, we took samples. So on most farms, we took between 10 to 20 samples, nasal swabs and fecal swabs from the calves upon arrival, within a week of arrival onto the farm. And then we took 10 to 20 samples from calves after weaning if they were roast veal or dairy source beef, or over 8 weeks of age if they were white veal. Then we also took one slurry sample, and if the investigator didn't want to dive down into the slurry pit, we asked for a composite environmental manure sample. All of these samples, all of these swabs then were analyzed for bovine coronaviruses using RT-PCR. From all of these sampled animals, we also took a serum sample. We also want to look at the antibody levels, and these antibody levels were quantified with ELISA. And they were all sent, all of these samples were sent to the laboratory in the Netherlands, Boxmeer. This is the statistical analysis approach I will get into later. I don't want to go into all of these data, but in general, what's important is that I'm not going to look at the level of the virus in these individual calves. It's a snapshot in time. A calf will be classified as a positive or negative. I will compare how much positive samples I get from the nose versus the fecal samples and so on, but I cannot really quantify levels of virus levels in the individual animals here. The same for the antibody levels. Most likely, we will categorize them into from 0 to 5, something like that. And we can maybe use the titers as continuous measures. And then we're going to run these analyses to see what are the factors that influence the level of bovine coronavirus in these calves. And of course, since we have multiple samples of calves within farms, these will be random effects models where you control for the multiple samples on a farm, combination with logistic models and so on. So I want to show you, this study is still going on. I'm still getting samples coming in here for very many farms like in France and so on. But you can see here we have samples of farms all over Europe again. And we have white veal farms in Belgium, the Netherlands, Italy, and France. And the calves on these farms, they can come from everywhere. So like the white veal farms there, like in the Netherlands, sometimes they're German calves there, sometimes they're coming from the Eastern Europe. It varies. For the rose veal farms, we have them from in Denmark, Spain, France, and the Netherlands. And for all of these calves, we are actually asking, what's the source of the calves? Because then we can maybe see the transportation, how far they're gone. And then we have the dairy source beef farms, Spain, Hungary, Norway, Romania, Sweden, United Kingdom. So you can see there's a variability here, but honestly, they're all mostly Holstein, but there could be some, mixes like a Holstein with a bit of Belgian blue-white or so on that goes on, or some other. But they're predominantly Holstein calves. And also what we're asking in all of these places is, where are you usually taking the calves from? But it can vary. And if we can get the information of when the calf, what country they come from, that is also part on the individual calf sample, because then we can get an idea of how long have they been transported. So what are the results? Again, these are interim results here from these 51 farms. Well, there was one farm in Sweden where we only found 10% positive calves. The rest of them had more than 50% positive calves. And now we need to remember, of course, that these small swabs is just a snapshot in time. With that, what is the sensitivity and so on, I can't tell upon that one, but it's it sounds like just about all of them are very highly positive. And what's really interesting here, you can see that we found it positive PCR samples in 91% of all newly arrived calves. Every single calf that is coming in, we find the virus in the nasal swabs and or the fecal swabs, and many times in both of them. When we're sampling the calves when they've been on the farm for a while, you can see the prevalence have gone down here. In 58% of the weaned calves, we're finding the virus. And in just about all of the slurry samples also, again, 70% of the slurry samples, we are finding a lot of virus. So this is clear. Bovine coronavirus is happily swinging around here in just about every single calf in Europe that's destined for beef. So here's a description here, just just kind of getting how prevalent it is here. If you're looking here in the various farms that are sampled on the bottom here, you can see that Swedish farm here to the left here, and then you can see the rest of them all have about 50% of positive calves here in the young ones. When I was comparing the different production sites, I just looked at what's the prevalence of coronavirus based upon the production types. They were really similar across. But you can see here the white wheel here, they have a bit lower level of bovine coronavirus in the calves at 8 weeks of age compared to the weaned calves in the rose wheel or the dairy source beef. I haven't done all the risk factor analysis yet, but my kind of thinking here is it that these calves here at 8 weeks of age in the white wheel are not as stressed because they haven't been weaned, because weaning is a huge stressor, and regrouping that many times happen at the and therefore we have a lower, that could be, but so it remains to be seen. When we're looking at the antibody levels, of course, to no surprise, we have high levels of antibodies in these calves. What we noticed was in the newly arrived calves, we have about mean antibody levels of 58% in inhibition. And as you can see, it goes down a bit in the weaned calves. And here I've described a bit the percentage antibody with increasing age. So you have the age here in months here to the going backwards, and then you have the antibody level distribution. And you can see here when the calves are coming in, we have quite a lot of animals. The first set of bars here, the ones in the light blue, when they're coming in, we have a lot of calves exhibiting antibodies here to bovine coronavirus. Now, these antibodies are highly likely from calves that are coming from dairies where they've been using coronavirus vaccination of the dry cows. And as you can see there, over the first second, third, and the fourth month, we have this very similar distribution, whereas in the fifth month, then we're seeing actually an increasing antibody levels in the calves. Could be likely due to that we have a renewed infection, and also that the colostral antibodies now have waned off and the calf is mounting her own immunity. So we don't know to what extent these colostral antibodies are protecting these calves from clinical disease. But I know already from hearing from many dairy pharmacists that when they started in Europe now using this nasal Gen C to vaccinate against bovine coronavirus, they have less respiratory disease. So it's most likely that the dam vaccination against bovine coronavirus is not sufficient to protect these calves, especially not after weaning when they're going through these huge challenges. When it comes to the biosecurity, well, there's a lot left to be desired here. But honestly, you know, I can understand these farmers. I mean, they're taking calves everywhere, and they're going through marketing centers and distributors. I mean, they're just scraping up all of the calves that happen to be born male. And I can understand that they maybe don't really understand the value of then suddenly having a huge level of biosecurity, since they know that these calves are coming in with everything. So biosecurity on these farms is really low. The overall score, when we're looking at it, is around 49%. You can score up to 100%. Well, this would be a failing grade in any school, you know. External biosecurity is around 45%. Internal is around 52%. So the impression I'm getting here is that the solution here to limit bovine coronavirus spread in dairy source beef, veal, rose veal, is not going to be increased biosecurity. It's just not going to happen. The whole systems are really so problematic in terms of biosecurity. We need to really focus on the animal's immunity. And as we've been talking through today with the co-infections with various viruses and so on. And when we are looking at the biosecurity, again, I will analyze it further, But it's really not that the farm that had 10% in Sweden didn't have a better biosecurity. You know, honestly, and the rest of them, I don't think I will see any impact of biosecurity on bovine coronavirus. I have not done that in our dairy study. So I don't think that the solution to the bovine coronavirus lies not in increased biosecurity. So in conclusion, yeah, it's highly present in both respiratory and enteric pathways. And as I mentioned, yeah, just about every single one had tons of bovine coronavirus. So it's really what I see, this is like a super shedding, super spreading event. And how we now will work further here to limit the impact of bovine corona, of course, I think a lot will lie in looking at the immunity of the animals. And I think that this is one also is an extremely important task, because we know that all of these viruses, all of these respiratory viruses, they pave the way to antibiotic use and because of the bacterial pneumonias. And even if there's not any bacteria, we've heard that they're treating a lot just with antibiotics. So I think it's absolutely necessary that we put the focus on that this is the way to reducing antibiotics, is controlling these viral infections better. So, as I mentioned, this is a preliminary study to be continued. Maybe when we go to Turkey, I can present you all of the risk factors and what we came up with. And with that, I would like to say thank you, and I'd like to thank you to all the participating farm investigators, the veterinarians, all of the MSD country representatives been chasing samples for me, the lab in Boxmeer, and so on. And I think that we most likely have some time for questions.
Thank you. And it's open for questions, suggestions, ideas. Do you have questions? Do you want to explain something more? What's for you surprising? What's your recommendation? Did you thought it's a huge amount of corona before you started? Something like that?
Just my impressions, you know, as regard, yeah. I think that in just about everywhere now, we need to keep putting the focus on that. The bovine coronavirus is one extremely important virus in the respiratory disease complex, and putting that into focus and into context with all of the other BRSV and parainfluenza 3 and so on. I think that is really important. But I also believe that when it comes to these, the dairy source beef industry, we're having a huge challenge. And in Europe, we have a huge pressure now to reduce antibiotic use and so on. So the question is, will we be forced to change this in the future, and how will that work? Because even with the best vaccines, I think that we will still always have respiratory disease challenges in this kind of system. So that's what I'm worrying about. But I do see the ability here to somewhat limit the spread and the control with a good vaccination approach here, especially for many of these farms here. You know, when they're getting those calves in, it's super easy to administer a nasal vaccine. It's a rapid response, and you can get to protect the calves early on. And as I said here in this study, we cannot tell to what level of do we have diseases in these calves. We don't know at this. Based upon this study, we have other studies showing that clearly it is contributing to the disease situation.
Thank you for very interesting data, information. So I have surveyed the coronavirus, so try to detect the coronavirus by PCR in Japan from the more than 1,000 samples. But the positive rate is less than 1%. But this data is very different from your data. And so, but at that time, I just collect the fecal sample. And so at first I thought, the nasal swab sample can detect the coronavirus easily. But so your sample, your data showed, so the positive rate is almost same from fecal and nasal swab. And so then, and so I'd like to know the level of the antibody. So from my data in Japan, just so the very low level of the positive rate, and so your data show the very high positive rate. And so you show the level of the antibody with ELISA. And I performed the HI test. And then I would like to compare. Then if you have performed the HI test, I'd like to know the data.
I must say, I understood that you don't have the same high recovery rate in Japan, but I wasn't quite sure what your question was here. Yes, we do indeed. We found it at equal levels, whether it's nasal or fecal swabs. And it wasn't like it was all fecal recovery in the neonatal calves and all nasal recovery in the weaned calves. And honestly, it's the same virus that is playing around, and it's coming out both ends at about the same level. We have a lot of calves where we just found it in both of them, yes. But of course, could be that you actually do not have the same level of spread in Japan as we have here in Europe.
Sorry, how about the HI test? Antibody. Have you performed the HI test? Vaccination inhibition, HI. We usually perform the HI test for the coronavirus antibody.
Yeah. Virus neutralization test? Or? Oh, the antigen test.
Yes, did you perform this test?
Yes. We used ELISA to quantify the antibody levels, yes.
How about the range of the HI titer with those kind of curves, so with high positive rate?
No, we haven't run. Geert, do you know what he's referring to?
Sorry?
The test we used is an ELISA from Bioix, so it's an optical density inhibition test, and it ranges from a value between 0 and 100. And then you have a semi-quantitative correlation with pluses, so it goes from 1 plus until 5 plus. So the results we showed here in an average, we have values of 40 inhibition, which corresponds with 2 pluses.
Yeah.
Okay?
So it's semi-quantitative, yeah.
Thank you.
Yeah.
Thank you very much for the discussion and the presentation.
Thanks so much for your time. I hope to see you in Istanbul in the next Congress. Welcome to Mexico and enjoy it. Thanks so much.
Thank you very much. Acá, mira. Laura, ponte ahí. Al final lo hicimos solos.
Pues sí. Iniciamos y terminamos. No, pero la verdad que